Dámy a
Ladies and gentlemen, good morning. My name is Sarah Polak. Welcome to the second day of our conference, Digital Czech Republic. Yesterday was a very busy day. We covered various topics, starting from cashless society, AI regulation, etc., etc. And today we have yet another busy day. So welcome to the second day that will be introduced by Šárka, who is the member of the board of directors of the European Liberal Forum, co-organizer of this conference, together with the Institute for Politics and Society. Šárka, the floor is yours. Ladies and gentlemen, on behalf of the European Liberal Forum, I have the honor to welcome you to the Digital Czech Republic Conference. Our forum is a traditional co-organizer of this conference and has been at the side of the Institute for Politics and Society since 2015. eHealth spreads liberal ideas and gives voice to all European citizens. And this is a task that was directly affected by the ongoing digital transformation over the last 2 decades. Data generation, collection and evaluation is everywhere, and therefore it is crucial that organizations and government agencies use this data efficiently and securely, and that the use of data is beneficial to all citizens. People have the right to digital civic services. However, in order to use the data effectively, public authorities must help the citizens, as they must work with the data safely, responsibly and effectively, and only then citizens can make most of them. Both private and public sectors are taking advantage of the opportunities offered by digitization, as they simplify the lives of citizens. However, there have been certain obstacles. Although 5.5 million of citizens have a Facebook account where they publish details about their private lives, many of these users do not agree, for example, with sharing of health data in case of emergencies. One of the key challenges is to reach the public and explain all the key aspects of digitization. Digitization should become a common phenomenon, not a concern, and therefore the role of the state must be changed and there must be trust of citizens. Unfortunately, today citizens often do not trust their governments and governments do not trust their citizens. Red tape that should help to bridge the gap often has the opposite effect and complicates the citizens' lives. Therefore, a solution is needed. We can look for inspiration, for example, in Estonia. Estonia's experience shows that this issue can be worked for the benefit of all. The Estonian government gained the trust of citizens and created an effective system focused on the users and their needs. There is no need to digitize the whole system. It's needed to reach an agreement on basic common principles and set aside cumbersome rules to simplify procedures and get rid of unnecessary data collection and build more open and transparent system. This conference is an opportunity to share ideas, experiences related to digitization and the opportunities it brings to the society. That's why I'm glad that we managed to organize the Digital Czech Republic Conference again this year, albeit in a slightly non-traditional format. I hope that this year's conference will be beneficial, and I hope that we will be able to meet here again to better understand where we have got. In conclusion, I would like to thank the Ministry of Health, Ministry of Industry and Trade, Ministry of Finance and the Ministry of Education, Youth and Sports as they took over the auspices of this conference. And on behalf of eHealth, I would like to wish you a pleasant conference and look forward to interesting discussion. Thank you very much, Šárka Prát, who is the member of the Board of Directors of the European Liberal Forum. Her ideas really resonated with me as the divide between the public sector and the citizens is quite obvious, and hopefully digital tools can help us. But it's all about education, efficient education of the current generation and the younger generation. And who should talk about education but the Minister of Education, Youth and Sports, member of the government. I pass the floor on to you. The COVID pandemic can be viewed from a dual perspective. One perspective is that it is a period of damage, suffering and hardship, and it is certainly true. But you can look at it as an opportunity. The pandemic showed the shortcomings of the Czech education system, but also it led to awareness of those ways how to remedy them. It relates to insufficient digitization, digital competences of teachers and pupils. So these are things that have turned out, and thanks to Czech teachers and Czech schools, we have started addressing them. And I'm glad that the ministry contributed to this, not only in the form of methodology, but also offered financial interventions. And we succeeded in digitization of education, but it has to be transformed into a systemic solution so that the Czech education system can perfectly balance face-to-face and distant education. And we should have a debate about it. And one of the platforms where this debate should take place is this conference. So thank you, Roberta Plaga. We talked about ways and methodologies that could help us in education, and how could we do it within the context of the Czech Republic, and why don't we get inspired by Mariya Gabriel, who is the Commissioner for Innovation, Research, Culture, Education and Youth from the European Commission. The floor is yours.
Ladies and gentlemen, good morning and welcome to the second day of the Digital Czech Republic Conference. Let me start by thanking the Institute for Politics and Society and the European Liberal Forum for inviting me to speak today. Even under the current circumstances, you have done a remarkable job organizing this conference and on an issue that is very close to my heart. The coronavirus crisis has had a profound impact in so many aspects of our lives. It has changed the way we see education. It has led to research and innovation efforts on an unprecedented scale. And it has undoubtedly led to a society that is much more reliant on digital means. In the wake of the pandemic, Europe showed which values define us. As we looked to solve the challenges of our society, we did so in a human-centered, equitable, sustainable and ethical way. We looked to the pan-European innovation ecosystem to deliver the innovation needed for a sustainable and resilient recovery from the pandemic, accelerating the green and digital transitions. We took swift action. We immediately prioritized the research and development of safe and effective solutions to tackle COVID-19. We pledged to invest 1 billion euros from Horizon 2020 under the Coronavirus Global Response Initiative. 800 million have already been invested. And we invested on what became the world's first approved vaccine against COVID-19, the BioNTech Pfizer vaccine. Our education institutions also had to adapt, sometimes almost overnight. Over the last year, they had to adopt distance and online learning practices for over 100 million learners. Teachers were innovating day in and day out, helping their students learn in new ways. This shift, bringing digital technology into education, is no longer something to prepare for the future. It is in full swing, and we as Europeans reacted well under the circumstances, but there is much to learn from the challenges we faced. Indeed, our new Digital Education Action Plan was drafted with the focus precisely on learning from the pandemic. Not only are we accelerating the rollout of digital education across Europe in an accessible and inclusive manner, we are also addressing lessons learned. First of all, 32% of pupils and students in member states did not have access to the internet or to important digital tools during the lockdown in spring 2020. Equity and inclusion are a big priority for me, and so we are helping member states address gaps in connectivity and digital equipment in and outside education and training institutions. Second, prior to the pandemic, only 39% of teachers in the European Union felt prepared to use digital technologies for teaching. From the experiences of our educators, we learned about their needs for training and strengthened digital competencies. That is why we are boosting teacher training, for example, through the Erasmus Plus teacher academies. The academies will help our teachers develop new digital pedagogies, sharing experiences across borders, learning from each other, and boosting their career development in the process. At the same time, we are developing tools for teachers to learn how to develop their digital skills further. I'm very proud to share that the platform of the European Framework for the Digital Competence of Educators, DIGCOMP Edu, is already available to help teachers get more digitally competent. Third, we'll continue to work with the member states, developing policy guidance in areas that can benefit from all these experiences in such a short time. For example, we are developing recommendations on blended learning in primary and secondary education, or on promoting digital literacy and fighting disinformation. The Action Plan's Digital Education Hub will play an important role here, reinforcing cross-sector cooperation across Europe. This should make sure our support takes everyone's perspective into consideration. In conclusion, we have learned a lot, especially that we need to continue to work together. And it is precisely conferences like this one that will allow us to draw more lessons and provide more innovative learning experiences to our students. I wish you a fruitful conference. Thank you.
Thank you so much, Mariya. Děkujeme, Mariya.
Thank you very much for this international insight. And now I would like to pass the floor on to Věra, Jourová, who will conclude the first block of keynote speakers. The floor is yours.
Dámy a pánové, dobré ráno, jsem velice ráda, že jsem...
Ladies and gentlemen, good morning. I'm very glad to be with you.
Happy to be here with you in Prague. This is already the 6th edition of a conference that is always marked in bold in my diary. I am very happy to witness how this event grows, not only in the Czech Republic, but also internationally. I think this is a symbol of both business drive of Czech digitally minded entrepreneurs, coders, developers and engineers, and of political determination to harvest opportunities and create an edge for the entire country. There is no doubt we are living in the digital decade. The digital transition is inevitable and digital technologies are helping us to keep going in the days of COVID-19. Many of us need to work just a laptop, work just a laptop, a phone and an internet connection. In my mind, there are no questions about the benefits, but we have to realize there are also many risks. Let me start with the intersection of digital and democracy. Democracy is under stress because of all these changes and tense atmosphere in time we live in. Democracy does not defend itself. It is not automatic. There is no reset button. That's why we need to mobilize not only all forces and the EU institutions and the member states, but also the society as such. I don't believe there is a silver bullet, one solution. that will solve all issues stemming from the digital transition for our societies. And contrary to what is often alleged, the Commission's drive is to support and speed up the innovation, to support business and not to over-regulate if this is not necessary. This is why in the first 1.5 years on the mandate, we have presented a number of initiatives to meet these objectives and address mainly the biggest risks. Why? Because for the digital transition to be successful, we have to help generate people's trust towards it and towards digital solutions. Without it, the transition will risk generating also a lot of frustration among some parts of the society, and this we should avoid. What does it mean in practice? Most recently, we presented the Artificial Intelligence Act to address human and social high risks associated with the specific uses of AI. It is the first set of rules of this kind in the world. The logic of the proposal is very simple. The higher the risk for your rights and safety, the stricter the requirements for using AI systems. I need to mention, of course, the online platforms that are influencing our lives and where we have been relying on voluntary agreements. It became obvious that the day of regulations would have to come. Last year in December, we adopted a Digital Services Act and Digital Markets Act, bringing enforceable obligations, high standards of transparency, and increased responsibility of digital players. The platforms are not just economic players. They are a place where increasing part of public debate takes place. They are channels of information for many of us, especially in the younger generations. We saw it in the magnifying glass during the COVID-19 pandemic, which has accelerated and transformed the challenges of disinformation and the growing polarization of the society. Therefore, I came with the European Democracy Action Plan. A centerpiece of our efforts on online disinformation has been the self-regulatory code of practice on disinformation. This was an innovative and important tool, but our assessment showed clear shortcomings. I will present, therefore, in 2 weeks a guidance setting out the Commission's views on how signatories should strengthen the code and create a more transparent, safe and trustworthy online environment. At the same time, we must not be naive. While it is now too cheap and too easy to massively amplify manipulations on the platforms, disinformation does not fall from the sky. These are malicious actors who want to undermine trust and sow divisions. So deterring, that is something we need to do as well. Then we announced in the plan legislation on political advertising, because the use of algorithms and use of micro-targeting in a business model used by tech for advertising and selling their products. But for me, there is a big difference when they use a technique of targeting and micro-targeting for selling shoes, and when they use the same method for selling political ideas to the citizens. We have to be mindful of this difference. When I heard the former president of Germany, Joachim Gauck, saying that he has a feeling that in Europe we only have consumers and we do not have citizens anymore, I know exactly what he meant. So we are working on that now, and we'll adopt a package relating to political life and how to keep our elections fair and transparent in the digital context. I started by mentioning the digital decade. I must now comment on our strategy with the same name, which is Europe's Digital Decade, published on the 9th of March this year. Here we presented a vision for the digital transformation in Europe, a perspective of innovative businesses and empowered citizens in a sustainable, human-centered digital society. We make it clear that deploying digital infrastructures and skills and digitizing businesses and public services, while important in their own right, is not sufficient to define the EU's approach to its digital future. It is also necessary to enable all Europeans to make full use of digital opportunities and technologies. In the digital space, we need to make sure that the same rights that apply offline can be fully exercised online. It is for that reason that the Commission will open a wide debate concerning the digital principles that should underpin the European approach to digitalization. Here in the Czech Republic, this conference has been doing this for the last 6 years. So clearly, you are ahead of us. And I want to thank you for that. I count on the active participation of the Czech stakeholders in shaping the European framework of digital principles. We also want to support the people to become digitally empowered citizens and a digitally skilled workforce. The objective is to have at least 20 million employed ICT specialists in the EU by 2030. And by the same time, 80% of Europeans should have at least basic digital skills. The EU is experiencing structural shortages of advanced digital skills, which are necessary to harness the potential of digital technologies. Particularly in Czechia, enterprises face a major lack of qualified workers across the digital specializations. 80% of Czech businesses encounter difficulties in finding and hiring digital experts. That is the second highest share in the EU. Funds from 6 EU programs in the current multi-annual budget support digital skills development. To create interconnections between different public and private actors is the goal of the Digital Skills and Jobs Coalition. The coalition gathers over 560 companies, institutions and organizations that actively work to increase digital skills. In the past 3 years, 16 million people benefited from the training actions on digital skills pledged by the coalition members. This partnership also groups 25 national coalitions that gather the main partners on the national and local level. These coalitions work with schools, ministries, companies and NGOs to ensure that every EU country boosts digital talents. Let us also not forget about the importance of digital skills in the context of the Recovery and Resilience Facility, which I will talk about at the end, and which is an opportunity to boost digital skills through reforms and investments. In primary and secondary education, it aims to improve teachers' digital skills, increase students' digital literacy, and update the curricula to better reflect the technological change. It will support lifelong learning and increase the offer of online or blended university programs and modules. Czechia also aims to upgrade the skills of the existing workforce, foster specialized training at universities, and provide expertise in advanced technologies to companies, for example, through digital innovation hubs. In particular, the past year has demonstrated the importance of digital education and the role that digital technologies can play in empowering young people. In talking about the impact of digital solutions on our democratic societies, we also must not forget about eHealth. We need to act at EU level to foster digitalization and to link health data across the EU. This is why the creation of the European Health Data Space is one of the main priorities of the Commission in the area of health. And I'm very glad that Czechia has been actively contributing to the work of the joint action of the European Health Data Space. The Czech involvement shows the path for several other member states that will soon join the cross-border e-prescription and electronic patient summary services. I am also aware that this conference will talk about sustainable and smart mobility strategy. I would like to praise Czechia for being a founding member of the Sea Roads platform, which aims to support the deployment of connected, cooperative and automated vehicles on EU roads. The project is supported with 16 million euro in form the Connecting in Europe facility. The citizens of Brno, Ostrava and Plzeň are among the first European cities where cooperative intelligent transport systems have been implemented. These are all great initiatives and projects, but I hope that digitalization will step up a gear also with the crucial help of the Recovery and Resilience Facility that will make 672.5 billion euro in loans and grants available to support reforms and investments undertaken by member states, with a minimum of 20% of the expenditure going to digital transition. Just grants in the Czech Republic plan will amount to around 28 billion Czech crowns for digital transformation pillar itself, and a similar amount for further digitalization of education, transport and other sectors. I am very glad there is a lot of support for various digital initiatives in the elaboration of the Czech National Recovery and Resilience Plan that needs to be approved by the government, the Commission and then by the Council. I would like to stress that the recovery plan is not only the main condition for investments from the Recovery and Resilience Facility, but it has also to be complemented by reforms. It is a great opportunity to step outside the box and move the country forward to the digital future, to catch up with the top countries in digitalization of state and economy, for Europe to make a quantum leap. Therefore, I am pleased to see that the draft Czech recovery plan is focusing both on e-government and public systems, crucial for all citizens, but also on digital economy, from building the digital highways, 5G networks, to supporting digitization of the small and medium enterprises. For me, it is of special importance that the Czech Republic intends to join and support many initiatives led by the European Commission, for example, the quantum communication infrastructure, digital innovation hubs and European Digital Media Observatory, a project focused on addressing disinformation in the EU. In this context, I would like to congratulate the team of SEDMO consortium led by my alma mater, Charles University, which was recently selected to build one of the 8 EDMO regional hubs. The aim is to fight information manipulations also with artificial intelligence and help also media literacy. It literally combines all the important topics I have been talking about now. Artificial intelligence is a topic I speak about at this conference every year, and I am also happy to see progress and AI becoming a flagship for Czechia. We also plan to invest 1 billion euro per year in AI from the Digital Europe and Horizon Europe programs, and the overall aim is to attract more than 20 billion of total investment in AI per year in the EU over this decade, and the recovery plan can play a very important role. I want to see European centers of excellence and world-class reference testing facilities to be built, and it is very good news that the Czech Republic still has a very high ambition in this regard. I am sure that the discussions today will bring a lot of useful insights into how the European Commission can further ensure that digital transformation supports our democratic societies. Whether it is in the area of eHealth, digital education or urban mobility, we cannot forget what makes the European way of digitization so special, and that is precisely its clear foundation in our founding values of democracy and respect for human rights. Ladies and gentlemen, thank you very much for your attention.
Já moc děkuji Věře Jourové za její
Thank you very much, Věra Jourová, for your contribution. And this concludes the block of keynote speakers of the second day of our conference. I'm glad that I heard about AI in connection with healthcare several times, because here AI could help us a lot. And this is the topic of the first panel, entitled "The Crisis as an Opportunity for Development of eHealth." Technology as an opportunity, crisis as an opportunity. These are important topics, and where to start but in the area of health, whether we talk about machine learning used for predictive treatment and others. These are the technologies that could help us and become more resilient against further crisis. So I would like to introduce our experts that will talk about this topic in more detail. So we have Petr Smejkal, physician and chief epidemiologist of IKEM, Daniel Klimeš from the Institut of Health Information and Statistics. Then we have Vladimíra of the same institute, Florian Markus, Digital Transformation Advisor from the Information Center for Estonia. And last but not least, Mariya Zeman, who is the digital officer of the Ministry of Health. And the whole panel will be moderated by Tomáš Doležal, who is the director of the Institute for Health Economy. And I look forward to your discussion. Thank you very much. Thank you very much, and thanks to all the speakers who are here with me or connected online. The topic is of key importance, and 4 years ago, when the agenda of today's government was being prepared, no one knew about COVID. But COVID actually gave us a great opportunity to actually direct the development in the direction that is needed, and I'm glad that we can contribute. I have prepared a short introduction that I believe are important. Many terms are used and mixed in relation to digitization in healthcare. I believe that if we want to have good digital services, we need to have digitization, digital records, digital communication systems, and availability of data within the system and outside of the system. Then these are the bases on which we can build basic services such as telemedicine, then often mentioned chronic disease management. Without digital health, you can't achieve that. But based on the digital availability of data, you could improve health literacy. And we know that people in the Czech Republic do not have access about quality data about providers or healthcare. And then further services such as automation and then application of machine learning or AI, because without the data, you are not able to implement these methods. And then it should lead to reduction of red tape. Czech healthcare is paper-based. And what is going on, including the new act, should lead to real decrease in administration and red tape. I believe that without these tools, the Czech healthcare is not sustainable from the financial point of view, because digitization means better efficiency and also sustaining quality and availability and perhaps increasing availability and accessibility of services. There are several problems related to legislation that are now being removed because of the new piece of legislation we will talk about. Then there is also the financial motivation to use digital tools on side of the providers, health insurance companies, or individual clients, patients, or other stakeholders. On the side of the patient, we need to definitely protect data, to ensure cybersecurity, to make sure that the patient's data will not be abused anywhere. We witnessed several hacker attacks with the aim of gaining financial gains. And if we look at potential benefits, we can look to the north, to the south, east, and west. Well, there are benefits for the patients related to comfort, time saving, access to health data, health literacy. That would mean that you can get access to data no matter which provider has them. And I believe that this will lead to better quality of care. And we always look at that. Providers have the potential to better organize their care, to coordinate among providers, among different levels of healthcare. You could also build on that reimbursement mechanisms that are based on outcomes. So this might lead to a substantial change of the whole system that is based on outcomes. And healthcare or health insurance companies, of course, they could help to find pilot cases that would validate what I have been telling now. I believe that it's good to look at the manifesto of the government that is dated June 2018. The ambitions were huge. And if you look at those 5 bullet points, what will be achieved, we hope it will be achieved, is just the preparation of the eHealth Act and the electronic prescription. Actually, if we wouldn't have it at the start of the pandemic, then it would mean a total collapse of outpatient care because the patients would have to visit their GPs. The rest remains still in the area of wishes, and hopefully this will become a major topic of the pre-election debates. In the official documents of the ministry, such as Health 2030, one of the focus is digitization, which is good. But we need to see a specific implementation project and control mechanisms that would help us achieve these objectives. What are the main expected trends of telemedicine? The Czech Republic, when communicating with the patients, depends on synchronous communication, so personal visits or telephone calls. Data are not shared among various types of doctors. Asynchronous communication is not used, and that's why there are no virtual program of care for chronically ill. Also, there is also not sufficient participation of patients in gamification and use of wearables. And also, the health insurance companies do not have sufficient data to base their reimbursement mechanisms on them. There is one of the poll that was carried out, and we see that patients are ready to consume digital health services, similarly to banking services, services related to their homes. They are ready to purchase and buy online. During the poll that was carried out several years ago, the Czech citizens expressed their interest in having access to their health record online, as is the case in the UK, Estonia, and other Scandinavian countries. And that should be the main pillar of the reform of eHealth. We are lucky that the EU has three main pillars in the area of health care, and that is have secure access and exchange of health data pooled for research and personalized medicines, and then to have digital tools and data for citizen empowerment and person-centered healthcare. So that was my introduction. I see lots of promising ideas, but lots of work. And we need to find a certain consensus so that the legislation of various types would also continue after the elections and are being implemented, as we will not manage to complete everything before the autumn elections. So that was my introduction. I do apologize for a longer introduction, but I think it was important to set the agenda. I mentioned several times that we are waiting for key pieces of legislation that will lay down the foundations for sharing data, registers, etc. And therefore, I would like to ask Vladimíra who is the Deputy Director of the Institute of Health Information and Statistics, to tell us what we have achieved, what still needs to be done for this piece of legislation to be adopted, and what are the main principles that this piece of legislation brings into the Czech environment. The floor is yours.
Good morning, ladies and gentlemen. To begin, I would like to extend my thanks for invitation to this key conference on the current status of digitization. I would like to share with you some information about removing one of the obstacles to eHealth, and this is the draft eHealth Act. This draft has been developed and prepared by the Institute of Health Information and Statistics. We received the task for the preparation last year in February. And then the pandemic broke out, so all the efforts were centered on addressing the pandemic issues, and of course our institute was extremely involved. After the legislative procedure went through, the government adopted the draft we presented in February this year, and it was sent for consideration to the Parliament when it went through the first round in March. The Health Committee of the Chamber of Deputies also approved the draft, and the bill is now awaiting a second round of consideration. We very much hope that it will be passed still before the election. The anticipated effective date is the 1st of January in 2022. It reflects the current processes and procedures. So there is a transitory period sufficient to implement the eventual act in 5 stages. So the actual effective date should be on the 1st of January 2022. And then there will be 5 stages, 5 phases of implementation, different parts. First of all, the bill promotes digitization of healthcare. The first stage should be the very basic elementary stage, which is represented by this bill. So it introduces the basic infrastructure for eHealth, including the basic databases and registers, and also unique identification of healthcare professionals, providers of healthcare, and patients. In the follow-up phase, which is currently being prepared by the Ministry of Health, will include the index of healthcare documents and the healthcare records, and this will include documentation records that stay with the regular provider, and also emergency records for the patient. So we are now currently at the stage of defining the content of such records. What are the key innovative aspects of the eHealth bill? They are listed on this slide, and they will be addressed specifically by my colleague, Mr. Klimeš of our institute. Thank you for your attention. Good morning, ladies and gentlemen. Let me follow upon my colleague who presented basic structure of the legislative framework. I will focus on the technical aspects and details of the bill. First of all, we intend to establish an integrated healthcare data interface that should include critical components. The first of them is the core registers, healthcare registers, that will identify the stakeholders of the healthcare system, that is, healthcare providers, healthcare professionals, so that is doctors, nurses, and so on, and then obviously the patients. The COVID pandemic showed that these registers are crucial for the field work so that all the stakeholders can share and effectively use the information. Another urgent requirement is trust, and it has been proven also during the pandemic. We need to be able for each of the stakeholders to verify and confirm their identity. This will apply to patients so that the patients can be identified and authenticated remotely in the systems. In the Czech Republic, this could be either the electronic ID. Unfortunately, the implementation and dissemination of electronic IDs is rather slow, so we are at the moment slightly lagging behind. Then we will need to have a unique identifier for the staff. So a healthcare professional should receive a unique identifier which would serve for authentication during access to different healthcare systems. We do have such an identifier for healthcare providers. They can obtain a certificate which is issued by the State Institute for Drug Control for the purposes of e-prescription. Thanks to the e-prescription project, we are able to implement similar parameters to the identification of healthcare providers. I would also like to mention central services of eHealth, which follow upon the key elements or components. Once we have an identified healthcare provider, a uniquely identified healthcare professional, we can use or provide services that will be provided by either of the sides, and they can communicate and they will be compatible. So this system then would allow for a nationwide exchange and sharing of electronic health records, which is one of the main purposes of the system. But it will also allow for auxiliary services, such as administration of access rights to third parties. Imagine, for example, minor children that have to be represented by their parents as their official representatives or authorized representatives. So this also has to be reflected in the system and should be part of the integrated healthcare interface. We should also develop and implement standards of eHealth for managing electronic health records and so on. It will be absolutely necessary to have such standards developed. It is not so important whether we are going to develop dedicated national standards or adopt and adjust international standards, or whether there should be an institution that would define these standards. It is necessary that these standards are in place and define the methods and rules for management of electronic health records and all the data shared by the system. Once we have an authority that will guarantee these standards, it will be much more certain that we can really progress in eHealth. And this is the objective of the current bill presented to the Parliament. So this was a summary from me what we can expect from the new integrated healthcare interface. Thank you very much. And I have additional questions that will bring us to the debate. You said that penetration of electronic IDs in the Czech Republic is low for the moment, but now there is the opportunity to use the banking ID also for e-health purposes. And there are over 5 million people using banking ID. So have you considered to allow access to electronic health records through the banking identity to open the opportunity for more people? Yes, banking identity is an element that we have been following currently, and it would open the system for many citizens. Electronic IDs, of course, have their benefits, but the penetration is slow and low, as you said. So banking identity would help us to bridge this gap, and it would allow citizens to access also the integrated healthcare data system. Yes, this is perfectly timed because starting from the 1st of June, banking identity can be used for access to other systems than only banking, so it would be perfect fit. I have a question to Mrs. Těšitelová. The problem in the Czech Republic is problem of unstructured data. The electronic health records are not structured. I know that in cooperation with the ministry, you are updating the decree on electronic health records. Could you update us on the progress of work and what is the time schedule, if there is? Yes. Currently, we have an interdepartmental working group established, which involves the Ministry of Health, Ministry of the Interior, and the Institute of Health Information and Statistics as the coordinator. And we are working on an amendment to the Electronic Healthcare Records Decree. And subsequently, there should be also an auxiliary or secondary legislation to the eHealth Act. As for the time schedule, the electronic health records, purely electronic health records decree should become effective together with the eHealth Act, that is on the 1st of January 2022, obviously provided that the bill will pass through the rest of the legislative procedure. We all believe and hope that this will be the case. So the new decree on purely electronic healthcare records should become effective on the 1st of January of next year. Thank you very much. Mr. Zeman, Mr. Klimeš mentioned that there is a presumption there should be a state national authority that would oversee the principles of and the rules of electronic data in e-healthcare. What is your view? In the Czech Republic, the DASTA standard has been used, but we know that there are also other international standards that some of your colleagues have already been using. Some of them are learning to use it. So what is your view?
In line with the eHealth Act or bill, we expect that it will be the Ministry of Health responsible for the standardization, and the National Center is part of the ministry. And of course, there'll be other institutions contributing, those that issue the standards or transform them from the international environment, such as the health insurance company, General Health Insurance Company, or the State Institute of Drug Control. But the key role should remain with that part of the Ministry of Health that will focus on prioritization of standards, searching for perspective standards, also standards for switching from old to new standards, compatibility with Europe, etc., etc. And all these processes have been described, and we have a catalogue of these processes. But we still lack the executive power to enforce these standards for the future, and we only can rely on positive motivation. So we have EU funds that needs to be linked to the fact that if they are used for digitization of health records, there must be certain standards observed, and this relates to both the healthcare providers and also developers of software vendors. So we need to really take care of that and work efficiently. Historically, we use our own version of most of the data, of the national data standards, and now we are including international standards so that we are able to introduce cross-border exchange of eHealth records, or perhaps to become involved in other projects and initiatives such as data sharing about rare diseases, etc. So I believe that the plan for the Czech Republic is quite specific and clear, and it has been specific and clear for several years. And we will switch to international clearly defined standards, and in the area of the most used code list, it's the national code list of laboratory items. It's the compatibility with the international code lists that were adopted by the EU, or they are recognized within the EU. So we are mapping and translating these code lists, and we managed to make sure that our code list could remain as is, and it will be fully compatible with the world. Thank you. And I have a question for Mr. Smejkal, who is an epidemiologist. So he is the one responsible for curbing pandemic. And the question is clear. From your position of a person who sees the system of public health and whether the system is able to respond to such a challenge as pandemic of COVID-19, where do you see the deficiencies of the system? And I know that you also have experience from the US, and we should not definitely follow everything that is going on in the US. But what do you believe are the major shortcomings, or what would help us if we would have it in February 2020, but we didn't have it? Well, I'm a chief epidemiologist in a hospital, and as a clinical specialist, and my experience from the US, whether, as you said, whether the pandemic could initiate huge changes, although in the US they actually were far ahead. There was the opiates pandemic that was actually present in the US, and everybody needed to know what are the prescription and which doctors prescribe opiates. It actually speeded up the fact that all the doctors were able to see the health records also of other doctors for the same patient. And this is an example of a bad thing actually leading to good changes. And if I move back to the Czech Republic, being an epidemiologist in a hospital, I was focusing on hospital infections. And I thought that we were only at the beginning of the path and that we had data, but the data were dispersed and it was not easy to get access to them. Also, hospitals have different structures of data. They were not aware of the standards. And that's why during the pandemic, since the very beginning, I was saying that what I'm missing is CDC, an institution. Well, we do have the state health institutes, but it should be actually combined with the Institute of Health Information and Statistics, as it would include the data, and then the data would be applied in practical sense, and the doctors would be able to work with it. So the fact that we do not have this integrated approach, that it's more or less fragmented, is the shortcomings. As we had data, but no one could get access to it. So that improved, but of course that led to distrust among citizens and also among experts, because without data, you are just another person or expert with an opinion. So we had experts that provided their opinion, and these were just opinions because they were not based on data. And we actually moved forward. And again, it was also a result of bad thing that lead to positive results. So if you compare it to the US, everybody here is asking which hospital should I choose? Could you refer me or recommend me a doctor? But the data should be actually accessible in the West. People can find what is the percentage of complications in case of this and that surgery in that or that hospital, and they can make a decision. So they do not have to rely on referral from their friends and relatives. And all of this starts from the fact that you need to have data, accurate data that is available and accessible for the public. So, that is really important, and for the patient to make the decision. So that is my position, and hopefully this will all be speeded up. What I care about most is to have this sort of umbrella institute that will combine the data and also this efficient healthcare institute with branches in all the region. And we could have just this state health institute that would also replace the public health authorities that we have right now. But that's the vision. Yes, the public health area has not been developed for a long time, and also it relates to data availability, data about prevalence, incidence, etc. I would like to give the floor to the Institute of Health Information and Statistics, as this is the institute with the largest sets of data. And the source of data that you've been using is the National Register of Reimbursed Health Services. And you have this register since 2016. So this is the information about all the medical devices and drugs, etc., services provided and reimbursed from public health. I know that you have the data, you work with the data, but both the expert and general public believes that the data is not accessible. So what is the vision of the Institute of Health Information and Statistics? And I do know that you are still dealing with the current situation, but what is the vision of your institute when working with this type of data, for example, also in an open data format, so that the scientists would know that, for example, on the 1st of January, on the 1st of June, they could expect data sets that could be used for, let's say, predictive modeling, etc. So what is the vision about publishing of data. I'm not sure whether Mrs. Tešitelová or or Mr. Klimeš would want to answer this question. Can you hear us? I would like to respond to this question, and hopefully it will be an answer about the near future based on the Health Services Act. The Institute of Health Information and Statistics is the administrator of the health system that was reconstructed in 2016 based on a new piece of legislation. And this system also includes the National Register of Reimbursed National Health Services. That means that all information about diagnosis, treatment, as well as reimbursement from the public health insurance systems are included there. As for the future, it is again related to the accompanying legislation to eHealth Act, as it will actually update or amend these Health Services Acts, and there is a provision about reference statistical data, and it means that our institute will publish a specifically defined data, also in the form of open data format, about healthcare. It's a new provision that will be included in the legislation, and it will clearly define at what date, what kind of data, what kind of structure of the data, based on what methodology will be created and also published. It means that the data will be also published per individual providers. So this is the future of data publishing, and you are right that we also are involved in dealing with the current situation, and open data about COVID-19 provided by us, and we try to make sure that we provide all the data about this particular disease to the general public, and more importantly to the expert public. So thank you very much for your answer. If we look around Europe and look into countries that progressed farthest with digitization, apart from Denmark or Germany or the UK, it's definitely Estonia, also in cooperation with Finland. I would like to ask Florian Markus to give us a brief introduction and tell us what were the key things that led to the fact that Estonia is, let's say, 10, 15 years ahead of the Czech Republic. So what were the key elements that led to the fact that the Estonia actually decided and went on this path? And what would you actually recommend to the Czech Republic that is at the beginning of this digital path, and what are the bottlenecks?
First of all, thank you very much for the invitation to this very interesting conference. I've heard many important points already being mentioned. One thing that contributed to the success of the eHealth system in Estonia was that we have a compulsory electronic identity that was implemented in the early 2000s. So in Estonia, I'm a foreigner, I'm German, but even when I come to Estonia, I get this electronic identity. And kids get it from childbirth, your grandmother will have it, you will have it, so anyone has it. And the realization that we've seen with the eHealth system and other areas of e-government as well was that if you provide services that solve people's problems, they will use them. So it doesn't matter whether we're talking about young urban students or whether we're talking about the more rural, older generations. If you create a digital service that is so user-friendly that they think, why did we ever do this on paper? Why, even if it takes 10 mouse clicks, I will learn this once, and then afterwards I can save several hours of stamping on papers and sending applications to the different government offices. And the same is true for the area of e-health. So in the area of e-health, for example, you mentioned it before, we have the e-prescription. The e-prescription, yes, it is digitally transferred and attached to your personal code, so to a citizen's personal number. But more importantly, in order to activate or to use your e-prescription in Estonia, you do not need any IT skills whatsoever. You just go with your electronic ID card to any pharmacy in the country, you put the card into the card reader, that's it. And then the pharmacist sees immediately what is the medicine that you are entitled to, and also what are the financial support schemes from the government. So you don't have to take the receipt and scan it and send it to the health authority or anything like that. It's all included in that procedure. So it doesn't matter whether, again, you're a young IT specialist or someone who we would call is in a digital risk group, because you just use the card. You don't have to type in anything. You just hand over the card and that's it. Another topic that was tackled previously was the question of public trust in e-government. And this is it's a very tricky situation because many governments have lost the trust of their population, sometimes for good reasons, sometimes for bad reasons, but nonetheless, that's the fact right now. In Estonia, we have solved this with two approaches. Number one, our services actually work, so they are so user-friendly that people are interested. And number two, we also enable something called the data tracker. In Estonia, you can go into your citizens portal and you can see every single time which government authority looked at what part of your data, when, and most importantly, in what context, for what reason. So the same is true for your eHealth portal. I can see when a doctor looks at my blood type, and then I can see is that context legitimate, or maybe there is something questionable going on. And if there is something problematic, I take that sort of screenshot to the Data Protection Inspectorate, and they will pursue this case potentially. When the system was introduced in the mid-2000s, there were some doctors that were caught by this system. They thought they could get around it, but they couldn't. So, for example, one doctor lost his license for life because he looked at the medical data of his ex-wife, which is obviously illegal. So these fines and sort of measures can go from financial fines to 14 years in jail. So we take data protection and privacy really, really seriously. And digitalization does not mean that you create a sort of big brother state. This is the big message that we want to give to the rest of the world as well. Last but not least, what we see in the private sector is a lot that Google Maps and so on, they track your data, they put it into servers around the world, and we don't care because we get through traffic 5 minutes faster. So this really has to be the logic. I mean, of course, the government has to focus on cybersecurity, on data privacy and so on. But the citizens do not care so much about privacy if the service that you provide is actually useful for them. So the government has to clearly focus on a more service-centered, citizen-centric approach to really get the interest and excitement from the population. So that will be a small introductory remark, but I'm looking forward to your questions.
Jedna doplňující otázka, jak dlouho a za jaké náklady
I have additional question. What were the costs and how long did it take before you rolled out the first stage of the eHealth to such a form that the patients were able to access the central portal remotely? So how long did it take and how much did it cost?
So the first question is a difficult one, and I have to admit that the Estonian government has not been very good at tracking exactly how much they invested into the different systems. What's important, though, is that the general infrastructure, the electronic identity, the data exchange protocol that works not just for the eHealth sector, but also for the other e-government areas, that those things are being used across all the different government sectors, so the costs are shared and are not just carried by the eHealth sector. About the implementation time, I would say around 3 to 4 years. So the government started working on this in around 2004, and the eHealth portal, together with the patient files and so on, were brought online in 2008. And then comes what some people call the chief information officer's nightmare, because you have this finished system and it all works great, and then you have to wait a few years for the critical momentum and interest from society. So there will be this sort of a couple of years where people will say, why did we invest so much money? Nobody's using the system. But they will, you know. Google Maps was also not used by millions of people on day one. It takes time to sort of for people to talk to each other and to exchange their positive experiences. The same is true in the private sector, the same is true in the public sector.
Další otázka, která mě zajímá.
Next question. I would like to know how you address the data management, data handling rights, because these data can be analyzed in large volumes, and of course it is a valuable commodity, in fact. So how did you set the rules for cooperation between the public and private sector? We know certain controversial cases like NHS and Google, or Israel, Pfizer and BioNTech, where they use the data. So what are the rules in Estonia? Can in Estonia a private entity approach you and purchase access to the Estonian citizens' big data or not?
So the quick overall answer is no. Estonia is quite focused on the data privacy of its citizens, and has usually decided against the different lobbies, both in the eHealth area and other areas. To give you an example, in some countries it might be normal for insurances to ask about eHealth data when they want to make an insurance application. This is impossible in Estonia. So it's always rights-based access through the system. Doctors have different kinds of access than nurses and other caretakers. Physiotherapists will have different kind of access than psychologists. So depending on what area you work in, you will see different parts of the system. This is very difficult to set up at the very start, you know, because you have to decide by law and by policy who gets to see what. But once you have that system in place, it's actually very straightforward, because also the the medical practitioners, they also log in with their government-issued electronic identity, right? So the government has certified that this person is let's say a doctor, and as a result, that doctor gets to see this data set in the portal. So yeah, overall, it's quite close, I would say, in Estonia. But of course, some open data is available on an anonymized basis. Right now, we have a very good tool for COVID analysis. So just like where do the cases spread in the country, in the different counties and so on. But this is, this is all handled on a confidential, sort of anonymized basis. And you will not see, I don't know, that Florian got infected 2 days ago in this city or anything like that.
Jednoznačně děkuji. Já myslím, že tady...
Thank you very much. Of course, we are talking about anonymized data sets. but again, the legal interpretation of anonymized data can be different. Do you have a comment on the COVID models? Well, from the viewpoint of a patient, for the patient, we know that the patient simply could not verify how many members of the hospital staff had already been vaccinated, or could not find statistical data about how many patients got infected in the particular hospital. So no data for decision making about which hospital might be safe or not. So these are COVID data that were missing, and I was missing. These were questions that people asked me. And that was one of the reasons why primary care was also reduced, because patients simply were afraid to go to a hospital for fear of infection. I remember a similar discussion a couple of years ago concerning vaccination rate against influenza, and it is very similar to the current situation. And now I very much apologize for leaving a lady to be the last. So now my question to Julia Bushande, who also has experience from the United States, and your viewpoint would be more of the consumer, the patient, the client. So where do you see the biggest potential and benefits of democratized access to patient data, so the patient-centered care? What will be the benefit for the system after the access to the data is open? Will it really lead to a more empowered patient, a more responsible patient?
All, thank you very much to the European Liberal Forum to invite Lauren Mason and Anna Comaccio to be here on this exciting panel from the US at 5 a.m. in the morning. To give a few insights about the pandemic from the point of view from the United States, we can say that in the US there is currently this trend of long haulers discussed a lot, that about 10 to 30% of the formerly infected COVID-19 patients will potentially have long-term impacts, and that will definitely have an impact on patients, on information, and on the problem solving via big data. We currently see in the US big data insights really being used in tracking apps, in patient active healthcare involvement. We have already before the pandemic seen that genetic risk factors that are in the blood have really been booming. Digital therapeutics are one of these trends that come out also after the crisis. But again, I think that to say the same things as the others, we do have these problems with privacy of patients. And in the US, we can say that Google had already is doing research on Google Health for a long time. They have this amazing data set of people, when they consume what, how the quality was, but they do not want to have a Google Maps for healthcare because they are afraid of stigmatization of patients who will be marginalized, pushed if they cannot compete anymore in the market. And as was said correctly, if you can track down the individual to their likelihood and prospect, how their health will develop in the future, that creates problems. There's currently at MIT and other areas in the US this idea to not track the individual, so not have the the information of the patient, or not have a large data set that someone can put together to a map where you can start marginalizing, saying in this zip code people are more likely to be sick. But to track via Bluetooth technology, track medical devices, where was what kind of medical device used, and the Bluetooth technology could also enable this opportunity to have a key to lock up medical devices, and you can open it only when you enter a key. So that is one of the breakthrough innovations, and will definitely stay on longer, that you use these tracking devices, but not track the individual, but potentially track the healthcare fingerprint. Another area that will definitely come out long term from the pandemic, and I see it positive as well, it's a good thing that comes out of a horrible pandemic, is democratization of healthcare information and medical information. We not only see currently in the US people stepping away from intellectual property rights protection in the TRIPS agreement, giving the information and vaccinations away to the world in order to save us from a constant upcoming of the pandemic in different parts of the world. We have already seen amazing leaps in telemedicine. People can be using access to affordable medicine through the internet. That helps on corruption, but again, it raises liability issues of the privacy of individuals. And definitely a trend that is currently in the US prevalent is, especially with these long haulers, these 10 to 30% of formerly COVID infected who keep on having recurrent waves of symptoms that come back in waves. We see this trend of online people gathering in groups that is faster, easier, and they're in social media groups, like for instance on Facebook, the long hauler group. People exchange information. They even exchange information to a degree that they completely lay open what doctors have advised them, and then discuss it openly. And you see the feedback. You see people sharing information. I used this medication and it didn't help me on this and that. So this group is online accessible. It's very easy for people to exchange freely information. But again, it's a problem about privacy. If someone misuses this data, puts it together in a frame where you can make assumptions about people's trajectories, and you could track down people. But this really ties into the previous comment. As long as there is a quick problem solving, people do not care so much about their privacy. And the very last piece, which what I want to leave this discussion right now, is the long haulers will be people who potentially are chronically sick and ill, but this opens also the gate for artificial intelligence and robotics to fill in gaps when these long haulers have these waves of recurrent problems. So these will be people who can function normally, and then every 2 to 3 weeks they have episodes of coming back recurrent issues. And here artificial intelligence could really be integrated into the workspace of a person, and when this person falls sick, all of a sudden the artificial intelligence take over. We already have in the US artificial intelligence helping to sort out complex environments. And we already have artificial intelligence learning email responses. And we could, for instance, use for people when they fall sick, then the artificial intelligence takes over for them for a while. And then when people come back again, they can follow up and they can simply look through what the artificial intelligence has already prepared for them while they were tired or sick and needed more rest. And especially rest and relaxation seem to be on the minds of these long haulers. And I do think that we will see a personalized individual healthcare. People will be starting to track their health status, and when they need this rest and relaxation, artificial intelligence will hopefully find their space while they focus back on becoming healthy again.
Děkuji, já bych měl otázku.
I have a question. What is the experience from the United States in the area of reimbursement of these technologies? Are health insurance companies are willing to cover wearables or these new technologies as part of the basic reimbursed services, or is it something that the patients need to pay from their own pockets? So what is the position of healthcare funds with respect to these technologies, as we will need to have this debate, what will be included into the reimbursement from public health system and what not? What is the experience from the US?
Yes, thank you so much for this excellent question. And this is exactly the difference between Europe and the United States. We have a different financialization of healthcare. So in Europe, you have this amazingly large data set. People give away their privacy about their medical records in lieu of free access to healthcare. We have a democratic healthcare. It's all about the patient and not where the patient comes from. In the US, we have a way more fractionated market. We have a private sector providers. You can choose your own healthcare plan, and the more you are willing to pay, the better usually the healthcare provider is, and the more is covered. In terms of your specific question, who's going to pay for what? I think it's too new. This trend of the long hauler is just breaking. You see in the media all of a sudden more and more information coming up. The CDC, as was mentioned, is currently working on the first guidelines, to my knowledge, so far on these long haulers. So there's more coming up. In the US, it will likely depend a lot on the legal aspects and class actions. So already now, I know from the Inter-University Consortium in New York that a lot of universities have legal advisors and consultants who help them sort out what happens if someone sues, if someone got sick at the workplace and starts suing. And I think this liability in the US, people will start suing. We see it already right now with vaccination problems. Also in Europe, that the legal aspect starts setting the agenda. In the US, you will have definitely after lawsuits also very entrepreneurial thoughts. People are simply trying and testing. They give their products for free for people who will be starting to use starting to use apps and give away their data. So in the US, I think the incentive will be that people have a problem solved on them. They will be starting to use the the tools for free in the beginning, and then once, as was said correctly, once there is a buzz out on social media, on these long hauler groups, that something is working, then people will be willing to pay for it. Will the government pay for it? We will see. We shall see. It will very likely also depend on where you got sick. I can imagine if you're in the military and you got sick in the military, definitely the US state will pay for it. If you got sick at your workplace, people will potentially start suing, and then the legal aspect will figure out, did the corporation do everything to protect, to learn, to stay healthy together in the workplace? And if a corporation can show this via a consultant, then the likelihood is that the consumers will have to pay for themselves, or there will be a settlement in between. And one more time, these self-help groups in the US, a lot of people report that they are happy that they can exchange information easily on Facebook. Sometimes in the US, it costs several $100,000s to get blood work interpreted. And there people come into these groups. They can share Facebook for free. They give away their privacy in the hope that in these groups they can exchange information and not having to pay for it. So I do think it will be depending on various factors. And in the EU, we already see with some problems with vaccinations. It first went on a national level. From the national level, it's by now up at European courts. And I was just last week presenting for the European Commission, and people were really pushing and pressing on the agenda of liability. Will the European Union have to find a solution for people who got sick, or who will have to pay for it? I think we live in exciting times, and there's definitely also an opportunity to integrate new technologies in our lives as we all embark on a journey of recovery.
Díky moc. Já myslím, že v Česku
Thank you very much. Yes, we see the two big trends, as you mentioned, as employers take more care of health of their employees and are willing to invest into. And we'll see what will happen with the economy after COVID. But actually, people are more willing to pay more for good quality care and perhaps to look for information. But one topic is important, and that is the post-COVID syndrome. So people who have symptoms for more than 12 weeks after the disease, and the British studies show it could be 15% of those who were positively tested, and there is no correlation between the severity of the disease and then the complications. So we can talk about 400,000 people. So how to get ready to identify these persons on time and treat them, because the sooner they get treated, the better we can actually treat them. What is your response, Mr. Smejkal? Yes, it's important to talk about it, and I think that we are lagging behind a little bit, and it relates with evidence-based medicine. So as soon as we have studies and evidence, we really need to face it. And we can't say anymore that people just make it up, these post-COVID syndromes. We need to deal with it. And once again, primarily it's up to GPs. And it relates to the reform of healthcare, because GPs should cover a much wider spectrum of services. So these persons should be identified by GPs unless the patients are not supposed to go back to the hospital after they go home. But if they then go to GPs, then the data should be provided from the hospitals, because often patients do not keep all the documents together. So, well, the system, and I'm not sure whether I have up-to-date data, but I know that lung specialists do a lot in this area. And for example, if the patients really should be also followed after they are discharged from the hospitals. So once we have data, once we have evidence, then we need to deal with it, and we should base it all on well-functioning primary care. The study that came up from the UK was actually based on eHealth tools. People filled in details, questionnaires online, and then immediately the country receives quite a detailed picture on what is going on in the country. The people do not have to go to their GPs because there could be several months of delay or even several years of delay. So this is a good lesson that we should take. But we still have 15 minutes left, and I would like to ask Mr. Zeman. We often meet at these conferences, and many people say that the problem in the Czech Republic is missing legislation, framework, standards, etc. We've been talking about this several times, and I think that we both have a similar opinion that it's not only sort of waiting for something to suddenly come and then everything will change. What is your perception? You meet with many persons, with patients, private sector, etc. Do you feel that what has happened in the past years actually made sure that what has happened means that we actually moved in the right direction and we won't be coming back?
I believe that, for instance, in the epidemiological segment or in public health, where we need to monitor development of contagion and infections online, really in real time, we had not been well prepared. It is obvious that things need to change. I think there has been a major turn in telemedicine. It is obvious that digitization in healthcare is not really monetization for private entities. It is a crucial prerequisite for keeping the healthcare system going. And I believe the core is robust electronic healthcare records, but there, so far, no major turn has happened. And for the time being, I don't see any breaking point ahead of us yet, even though it had been envisaged that 2021 should have been the breaking point, but the pandemic, unfortunately, has slowed things down. In order to have structured electronic records system, in order to have a trusted system and to convince patients that we make records only when we really need it, and to make sure that this documentation and these records remain available regardless of which stakeholder is involved in the particular moment. We want to make sure that from the moment of launching the system, we want to have it functioning. And the path to this moment is long, and we have walked a very short segment of this path, even though we do have motivation definitely in the private healthcare segment, but the government part so far has been too slow. We believe there will be an avalanche later on, but too slow in my view. Question to Florian Marcus. Would you know in Estonia what percentage of healthcare is provided remotely, if there is any statistics like that?
I'm not aware of any statistics at this point, but what I can say is that telemedicine has really helped, especially the more rural hospitals and doctors, because now they have very good access to the specialists from the capital and so on, because this is something that most countries would struggle with, that the best specialists would center around the bigger cities. And telemedicine can really help there. This is what we've seen in Estonia. What we've also seen was that one of the the first COVID wave did actually not hit in Tallinn, in the capital, but on the islands for one particular event reason. And so from that point, we needed to have all of these experts in connection with the islands. And telemedicine was one way to get that connection done faster and more securely than through traditional doctor exchanges or anything like that. So yeah, no statistics at this point, but happy to provide later.
Pane doktore, já jsem ještě chtěl na tohle reagovat.
I also wanted to respond. Our problem in many cases was that many patients arrived at hospitals with COVID infection too late. It is a known thing that many patients simply could not or did not know how to measure oxygen saturation. And many GPs talked to them over the phone and simply did not get enough information. So telemedicine can be useful, but in many cases, you need to have a physical contact with the person, particularly in case of elderly people. Even under the guidance of the GP, they were simply not able to use the devices efficiently and read out the values properly, so they came late to the hospital. So if the physical contact can be substituted in certain cases, not always, then you really need very good technology. So you need to make sure that through the technology you can see the patient and either decide it's fine remotely, or you need to see the patient physically. So technology is today really not a barrier, but where the investment should go is the primary sector. Unfortunately, in the Czech Republic, most of the IT investments go to large hospitals. Of course, it is needed there too, but there should be dedicated schemes for the primary sector, that is for the GPs. Are there any plans to make this type of investments, whether from the recovery fund or elsewhere, that would really target at the general practitioners? They are really overburdened with paperwork, with conventional telephones, and it is a hidden threat, because with the overburdened primary care, it may lead to delays in special treatment in hospitals. So, are there any such plans envisaged? Grant schemes that would motivate or incentivize digitization on the primary care level unfortunately have not been available, and we have not been able to promote grants that would support technology equipment and software equipment that would help digitization. And we would like to see that, but so far we have not been successful. We can see elsewhere in the world that grant schemes that disseminate funds to primary care offices, surgeries, helping the GPs purchase software that would manage the elementary paperwork simply is not available in the Czech Republic. So unless there are sort of larger types of investments, the primary care cannot be covered. So once again, there is no such a mechanism as far as I know. Well, at least it is good to know there is a great debate ahead of us. Definitely, we will be learning from lessons of the last year. Health insurers admit that it is a question of economic sustainability of the system. You see, or we see, insufficient growth of available funds, and of course, digitization can be helpful eventually. We have some 3 to 4 minutes left. I have exploited all of my topics, so now I would like to address all of the other panelists. If there is anything that you want to share with us and we have not mentioned or covered yet, we have to hold such conferences now. Unless we use the COVID pandemic wake for radical reforms immediately, we will lose the momentum. 2 years later, everyone will be reiterating how good healthcare system we have, that we have enough hospital beds, and everyone will be complacent. And no one is measuring it because we have no data, so this is the risk. Florian?
2 very quick points. Number one, we have to consciously move from the crisis management and eHealth solutions that we see right now to a more concentrated effort. This is what we're seeing also this discussion about already. And number two, one way to motivate politicians on a national level is cross-border cooperation. We mentioned it very briefly at the start. So the more you say, why don't we make the e-prescription an international and EU interoperable solution? That's how we sort of get all these different countries in the same direction. So I'm looking forward to more of these initiatives to make sure that we're all on the same page.
Děkuji za tu poznámku. Já jsem to ve své úvodní řeči se snažil říci, že
Yes, thank you for this comment. I was trying to say that in the opening remark that the European Union prioritizes e-health and the digitization of healthcare system, and we should make full use of this opportunity also in the Czech Republic. I would like to thank all the panelists, also from abroad. I thank Julia Pushander, Florian Marcos. I thank Mrs. Těšitelová and Mr. Klimeš of the Institute of Health Information and Statistics, and Mr. Smejkal and Mr. Zeman. Thank you for coming, and I'm looking forward to the next discussions. Goodbye. And I extend my thanks to Tomáš Doležal, who led this panel on the crisis. I do admit I was listening to the experience from Estonia, talking about data transparency. In Sweden, the situation is very similar. If you offer blood for transfusion, you receive a text message that confirms that you provided blood, and you can see where it went, that it was used for good purposes. So that was the first panel. Now we have panel number 2, which is entitled Step Forward to Backwards, and what lessons we did. We have excellent and prominent guests on the panel.
We have Bob Kartos, the Executive Director of Prague Innovation Institute. We have Karel Kovář. We have Gunilla Svantorp, member of the Swedish Parliament. And I've already mentioned Swedish. Juho Helmient, Education Advisor, Finnish National Agency for Education. Tia Rutman, Professor of Tallinn University of Technology. So welcome, and I look forward to hearing from you. And I pass the floor on to Bob Kartos. Hello.
Jeden krok vpřed.
A step forward to backwards. That's the title of today's discussion on how COVID and measures fighting COVID actually affected the situation in various countries, the Czech Republic, Estonia, Finland, Sweden, so that we can have a good picture of what it means for the education. How did that affect us, and what kind of measures were adopted by various education systems? What would be the impact on the future? Because the end of pandemic does not mean that the effects of distant learning or teaching with respect to inequality or the increased standard of digital literacy will definitely have an impact or will show effects in the future, and we will talk about it with our today's guests. And I would like to have sort of first brief evaluation of the situation. So could you please say to us what are the main takeaways from your point of view? So what are the main takeaways and experience, and what do you think the situation has brought to us, and what is going to be important for education in the post-COVID era? What should we focus on, and what would be the major objective in education system in individual countries in Europe, but also in Europe as a whole, that is getting ready for a new plan to support education and to create a certain sort of European education space? Thank you for introducing our guests, and I would like to ask first our international guests, and we'll start with Gunilla Svantorp, who is the member of the Swedish Parliament, chairperson of the Committee on Education.
Thank you very much. And thank you for the opportunity to be here today. I'm the chair of the Committee of Education in the Swedish Parliament, and I'm a social democrat. I have been a member of the Swedish Parliament since 2010. For me, it's important that it should not be the family a child is born into that determines that child's whole future. All children must be given the opportunity to succeed in life. But that's not really what it looks like today. On the contrary, we know that the role of the family background is becoming increasingly important for school results and how well the children succeed in life. Today's school system fails to give all students equal opportunities in Sweden. That's not good enough. We have a difficult year with the corona pandemic behind us, a year shared by all the countries of the world. Everyday life as we know it disappeared. Our children found themselves missing school, the routines, friends, and also the teachers. As you know, Sweden chose to keep the primary schools open. The reason for this is that we know how much school means to many children, especially for the most vulnerable and those in need of more support. During the second wave of infections, we also had to switch to distance education for a few weeks in a number of primary schools located in regions that had been hit hard by the pandemic. Other parts of the education system switched to distance education already at the first wave, at the upper secondary school, adult education, and higher education. We know that it has been tough for many students. Again, we see that students with difficult home and environments have been most affected. Students who may not have their own room, digital equipment, or support from their parents. We also see that many teachers were not ready to handle digital tools and that many had to work very hard to support students despite the situation. But we also have many teachers that did it well. We now see a great concern that a generation of young people will lose faith. Many are doing their third semester of distance learning. It has a negative impact on the contact with friends, teachers, and how to look at the possibilities in life. We now must do what we can to increase both their hope and their opportunities in real life. The struggle to get a place at university is also getting tougher. The government is meeting this up with more study places and more opportunities for summer jobs. Many students are also worried that they will be judged harder and get lower grades. Here we look at the possibility of changing the admission to the universities so that more students can become eligible by taking a university entrance exam. But what can we say about the way forward? First, it's about getting better at using digital opportunities to offer distance education. Let me give you one example. Native language teaching could be made available to more students if we use digital tools and coordinated resources better. More could be taught by licensed teachers across the country. Second, we must realize that digital education is here to stay. That it is not about either teaching in classrooms or via digital tools, but that we have to use both. Furthermore, we need more research and knowledge about the benefits and disadvantage of digital teaching. Digital education has clearly taken a leap during the pandemic, but now we must make sure that we learn the right lessons from it as well. Another issue that I think is important for the future is how to strengthen teachers' digital competence in teachers' education, but also in the development of the profession. And finally, I would like to thank you again for the opportunity to be here today, but also to remind us all of the important mission the school has to never, ever leave any children behind. Therefore, it is always our job to ensure that the teaching method we are using is available to everyone. And thank you.
Děkuji za první
Thank you very much for your first contribution. So you heard from Gunilla Svantorp, member of the Swedish Parliament. So at the beginning, we heard that inequalities that were uncovered by the pandemic situation have a specific shape, meaning that children in democratic advanced countries should have equal access to education, but if schools are closed, children need to rely on the support of their families, and they should have accessible digital tools allowing distance learning. And it is difficult to ensure if everything is only up to families whose socio-economic situation might differ. But also we heard that there is an interesting lesson to be learned, and that is the increased digital standard in teaching. For example, foreign language teaching using a native speaker, where you can actually connect with a native speaker using the new technologies and improve foreign language teaching. But we'll go back to this topic, I'm sure. And now I would like to ask Tia Rutman, who is the professor of the Tallinn University of Technology, to take the floor.
Thank you for the opportunity to take part in this conference. And I would like to share our experience because on the March of 13, a year ago, we had to take our teaching from contact classes onto distance learning with a blink of an eye. That means before that, as you know, in technical teaching and in educating engineering, it's very important to have practical lessons, to have practices and labs. But in this case, we had to take all our lectures, seminars online. But I think we were successful because already 5 years ago, there was a decision at our university that all the subjects will have to have e-learning materials supporting learning for students in Moodle. And that's why we already had materials in every subject online. We had to add possibilities to activate our students to take to use new methodologies. And I'm very thankful for our university because already 3 days later, when we had to take our teaching to online courses, there were courses for the faculty, how to teach in a digital way, how to teach in a distant learning. And we started to create remote labs, online labs, in order to support our students' learning. But I may say that in one way we were successful, but from the other way, it's never possible to teach skills, communication skills, collaboration skills, practical skills over internet. We can give good, short, motivating theory lessons and activate our students by using different online tools in order to answer or decide or solve problems. But in engineering, and I think it's quite similar in medicine, that we cannot teach everything online. And that's why last year also we had to hold on for 2 months only having online lessons and distance learning, and then we were thankful to have the possibility to start with practical lessons at the end of May. And the same situation is this year, so next week our practical lessons will start again, and students can come together, though in a smaller groups. That means that teaching staff will have much more work to do, working not with one bigger group, but with several smaller groups. But our students will have the possibility to have this hands-on learning and learning by doing what is very important in engineering. But still, I may say that the experience of last year showed that we coped with the situation, and the feedback from students was very positive. Though they said they missed the teachers and they missed each other, but all the courses were completed, all the diploma theses were defended, and we learned a lesson that gave us lots and lots of new experience to go on. And I really agree that this distant learning and online learning is here to stay, but we can go on only with theoretical courses and seminars on internet. Thank you.
Děkuji paní profesorce.
Thank you, Professor, for your insight in the epidemic measures in Estonian education system, particularly at universities. Professor Rutman explained that it was easier to cope with the situation for those who had been prepared. University in Tallinn had materials prepared even before. So wherever digital tools had been used in a more advanced way beforehand, it was easier. It may be the case at several institutions in the Czech Republic too, but there will be much more gaps in the level of preparation. Yet, even in Estonia at the Tallinn University, it has proven that distant learning cannot fully replace personal contact and learning that requires practical contact with the learning materials. This applies not only to engineering and technical fields, but also, for example, to medicine, where you urgently need personal contact. And of course, this also applies to developing social and communication skills, which cannot be easily replaced purely by contact via online platforms. What is interesting for me is the comment on the positive feedback from students, which is also one of the issues that we'll be addressing later on. We will be asking how the Czech pupils and students and their parents responded, because from what we have seen so far, there have been many controversies about the approach to distant and online learning and what level of priority it receives in the society. With this, I would like to hand over to Juho Helminen, advisor at the Finnish National Agency for Education. Could you please give us your insight into the progress of COVID pandemic in the Finnish education system?
Opportunity to participate, I'd be happy to give a glance at the Finnish situation, and I'm honored to be in such an esteemed and company of high expertise. A real pleasure for me. So I will not cover so much about the background. First of all, I would like to say that the Finnish experience is very, very much similar to the ones of Sweden and Estonia. We have, I think, the same kinds of problems and vulnerabilities in our system, and also the same kind of strong points too. Our country was fairly well digitalized before the pandemic. Not the leading country in Europe, not in any way, but what we have been constructing a quite solid networks for schools, and the equipment situation also has been improving over years. Of course, the different levels of education have sort of faced the pandemics in a different way. our main concern has been concerning the primary education, since upper secondary has been digitalized already because of the digital matriculation exam. And all upper secondary students have the laptops in use for everyday school use. Also, vocational education is fairly well digitalized, but there the pandemic caused quite another kind of problems, because it's the studies go in practice with working life, and there were many difficulties, and we are concerned about the sort of the generation that faced the pandemics in vocational, because there are so many young people without grade and without the working place now. We are talking about 15% of vocational education students. Before the pandemic, we already realized that we have a growing digital divide. So our resources, the knowledge and capacity of teachers and schools is not divided equally in the country. The sort of touch to technology of the student depends on the municipality. It depends on school. It depends on the teacher, and that therefore we have already sort of launched a program to try to cope with this digital divide in education before the pandemic. But even so, we were not so far ahead in order to cope and take the results of that program to help us in the pandemic. We have had many studies from Finnish University, quite large studies on the effects of pandemic in the well-being of children. And one striking result is that how much the self-regulation skills of the students reflect on everything that happens, and it's sort of an amplifier to both the good and the bad effects of the pandemics in schooling. And we have discovered that we have many soft skills, like skills for the future or 21st century skills that make the sort of ICT skills, efficient ICT use possible in schools. So we have to focus on all kinds of skills at the same time. One of I think that the pandemic situation went rather well in Finland, but the overall sort of image is that teachers did not teach real-time video-based teaching enough. So it varied a lot, and there were some teachers that contacted the pupils on sort of only once a week, and that was there was a variety of different approaches from teachers. Those who took every lesson in real-time video teaching, who contacted every student, and the other end of the variety is that there were teachers that were quite passive, actually. And of course, the skills of the teachers, the whole school community affected greatly in the manner how the school could cope in the difficult situation. Our teachers are very tired of the situation, even still now, when sort of regional or local decisions are made in whether schools can be open or not, or classes in distance education or not. Teachers are very tired, and learners too are very tired. at this moment, and we are talking about, of course, we are talking about the homes that have also taken effect of the pandemic, and in those places where parents have to participate in the schoolwork, it is quite cumbersome for parents too, of course. Maybe if we talk about the positive sides, then we can honestly talk about a digital leap in Finland. Many teachers have had to sort of teach, learn new skills, learn new equipment, new methods of teaching, and of course students too. But what we should do, I think, is seize the moment, seize the opportunity, because so much new know-how has been built in the education sector. Of course, we have to wait until things settle down and we go back to normal. But I see a very big opportunity right now in the future to develop the digital pedagogies for all levels of education. Maybe I have to add that we have sort of we have realized that we need much more evidence-based knowledge. We need much more research, and also we need the school community to develop a new kind of resilience, new kinds of cooperation between teachers, cooperation within the whole school community, and of course dialogue with homes and parents. And these are something that we have to do anyway, pandemic or not. We have to address these questions, but the pandemic has sort of amplified the vulnerabilities and the strengths of the system. So this is an interesting, although humanly very tragic laboratory for the development of education. I think that we can see that the school community has been tightened and by the pandemic, and there has been a new sense of struggle and cooperation, and we have to seize that moment. And it would be very important to sort of see in the European context and work together as European countries, and why not globally too, in the face of new challenges for the system, pandemics or not. So I'm quite optimistic for the future, nevertheless. Thank you.
Děkuji panu Juho.
Thank you, Juho Helminen, for sharing your experience from the Finnish schooling system. You also mentioned the impact on the entire society. Let me start in my summary from what you said at the end of your contribution. You said that you actually see the experience as an opportunity which opened room for more tight relations across the society. You also mentioned some of the steps that the Finnish educational system took in order to cope with this situation and in order to make the system as accessible as possible to students. You mentioned that your situation was rather similar to Sweden and Estonia. At the same time, you mentioned several interesting examples that might serve perhaps as good practice for potential situations of similar emergency cases. You mentioned that the focus should be on primary education, and it applies to the Czech Republic because it is more difficult to use remote learning for children who are not so skilled in using technology. You mentioned that there is quite a large pool of surveys available in Finland which analyzes the situation. So if we are able to analyze the outcomes of earlier surveys, we may be better prepared. And if we can use the outcomes of this live laboratory, as you called it, it may be more easier to cope with such situation in the future.
And now, Karel Kovář, who is the Deputy Minister of the Ministry of Education, Youth and Sports. So how would you assess, also with respect to what you heard from our international guests and their insights in Finland, Sweden and Estonia, how would you assess the situation in the Czech Republic from the point of view of measures introduced in schools? How do we cope with the situation now? The experience in the Czech Republic is very similar to the mentioned countries. Also, the Czech Republic is a more advanced country within EU member states when we talk about using digital devices. But of course, the situation differs in various schools. Starting in March 2020, we closed schools. And what I really enjoyed was that teachers started to cooperate with each other. We had progressive teachers who wanted to use digital technologies, that were learning from each other. They shared their experience, and after they did their online training, they would share their experience with their colleagues. So there was a huge peer-to-peer learning. There was a huge community established, and it was done much better than what the ministry would be able to do. During the first phase, we had very good cooperation with the Czech television, and I really appreciate it. We had a special TV program for the smallest children, and it showed that we can actually involve excellent teachers, the best of them, and it was the inspiration for other teachers. And it also showed us the possibilities of digital or distance learning for the future. We will not be limited. And we would be able to see lectures of the best educators and teachers. Why not? What we did not succeed in was to unify the platforms and systems used by schools. And that was really difficult because of the support, because every single school or even teachers, even at the level of schools, we were not able to have a common platform so that the teachers would communicate in a uniform way with all the pupils and students. There is a very liberal approach in the Czech Republic, and for students and for teachers, it was sometimes very difficult to actually handle the IT equipment and to join in different classes. There was no major shift, even during the autumn times, after what we have experienced in spring 2020. And this we see as a major handicap, and we try to support major platforms. talking about benefits that we want to use as a basis for further development is that pupils could be actually connected to a class when they cannot attend the class. So we started testing elements of distance learning that we want to keep within our system. I assume that it will be true for secondary education. I believe that it's something as a must in universities, and hopefully it will be more introduced also on the higher level of primary education, so that there is more space available for practical classes. And during the first phase, we could continue for students who, due to health reasons, such as injuries, spending time in spas, recovering from an illness, or children with talents in the area of sports or art, or students who live for a certain time abroad with their parents. I think that for these students, the communication with their teachers could be more active. I'm not quite sure how we will be able to integrate these individual distance learning elements into the whole system. I firmly believe that the main mission of education is about transferring values. It's not only about knowledge and information. The emotional side, interaction between the teacher and the pupil is of key importance, and it's necessary. Also, distance learning showed to us that it's difficult to work with pupils that are less motivated, that are not supported by their families. So it cannot be a long-term or nationwide solution. It is something that could complement the education and could be used by certain students. And if the students are motivated, they want to be educated, then the distance learning could replace a major part of school. But if a student is not interested in learning, then they could participate in a very good quality e-learning, but the effect will be very low. In case of face-to-face learning, the teacher could work more with emotions of the student or pupils, and that's why this type of education is important. Also, I would like to mention here that it was a period of huge uncertainties. There were times when we really expected that at least some of the schools would be open, but it was not the case, as our situation in terms of epidemiology was very difficult. We are a small country with huge movements of the inhabitants, so we could not distinguish clearly regions less affected and more effective, and therefore the measures were mostly nationwide. And of course, that was a huge burden on the parents and families. And that's why we need to really make sure that education of children is not dependent on their families and the education of the parents. Unfortunately, I think that the gap even deepened in the past year, and we need to find a way how to get out of that. So that's the introduction, the situation about the Czech Republic. Thank you very much. For summing up the situation in the Czech Republic. You could see one of the questions that we will definitely discuss, and that is the impact on the situation on mental health of young people. But we'll go back to this question. Now, I would like to actually discuss some of the topics that were voiced during the introductory speeches. I am interested in learning, and this is a question first for Gunilla Svantorp. I'm interested in learning what were the priorities. What we saw in the Czech Republic was an effort to deal with pandemic measures in a simple way, and that is to close schools in the first phase. But in many European countries, actually, schools were the last organizations and institutions that remained open. So how the Swedish government approached this solution with the lockdown. So where the Swedish government closed the schools as first or not. And also what I would like to hear from the remaining guests, whether everything was done based on a nationwide measures, or was there competence on the local or regional level? The floor is yours, please, Gunilla Svantorp.
Paní poslankyně?
Unfortunately, we can't hear you.
Yeah.
Yeah, okay, yeah. I think it was an early decision from the government together with the parties in the Swedish Riksdag. We had a good cooperation between the government and all the other parties that we decided that the school is the last thing that we close and the first thing that we will open. That was our priority, and that's why we decided all together that the primary school should not be closed if it wasn't a high spread of pandemic in such area. But the normal thing should be to have the primary school open. And we also have discussions about the secondary school, but we decided to close the school because the pupils in the secondary school often take bus to the school, or they are much more out at the society than the primary pupils were. And therefore they were a bigger risk for the spreading of pandemic. So that's why we decided to have the primary school open. But it has been a big discussion in Sweden as well, not least at the teachers, because they felt that they were in the middle of the spreading of pandemic. So it has been discussions, but we have held the decision to hold the schools open as long as it could be, and also have the secondary and higher education closed. Yeah. But I forgot something, if I could take that now. We have also seen our dropouts. We have a lot of pupils that leave schools in some reasons. They are sitting home and will not go to school. It could have different reasons for that. And we saw by doing digital lessons in the secondary school that they went back to school. The dropouts came back to school when they could be at home and participate at the lessons. So that's a good example for that the digital lessons were good for some pupils. Thank you.
Děkuji.
Thank you very much. I'll just briefly sum up. Sweden decided to keep the schools open as long as possible and then open them first once they were closed. And the priority was to keep elementary schools open. and due to higher risks, due to higher mobility among older students or secondary school students, these were actually closed. And also the digital competence of secondary school students allows these students to be educated also in other ways than face-to-face. I want to ask the same question to Estonia. So what were the priorities in case of schools as institutions? They should be open or closed due to the pandemic. So what is the situation? What was the situation, Professor Rytman?
Paní profesorku neslyšíme nyní. Pravděpodobně došlo...
We had a scientific board at our government who also just consulted the government, and the decision was that we have to keep open the schools as long as possible and open them also as soon as possible after the worst pandemic. So the elementary school was opened the longest, and additionally, those students, pupils who were just graduating from gymnasium, from secondary schools, and they had also graduation examinations. So they were allowed to come to school for some days per week to have consultations with teachers in order to graduate secondary school and prepare for going on to universities. So we didn't have the possibility for local authorities to decide opening or closing the schools. So it was the decision of the government, and the schools were really opened as soon as possible for the elementary school children. And just now, again, the elementary school is going to school, but the other are just waiting for some 2 weeks, and then all the schools again will be opened. Universities still closed, so they were the last ones to open.
Děkuji paní profesorce za její komentář.
Thank you for your explanation about the approach that Estonia took. As we heard, the approach was very similar to Sweden, with emphasis on primary schools in particular. And there was also additional support to students in key moments, such as last year students at secondary schools. Mr. Helminen, what was the approach on the government level in Finland in that respect?
The lockdown of schools was a government decision based on a special legislation, and it applied to all education. After that, in the new term in autumn 2020, last year, the decision was moved to the local authorities, and it was the main task, of course, the main idea was to keep the schools as much open as possible. And a special attention has been attended to the pupils with special needs. So those pupils, the schools have throughout the pandemics been open, unless the situation, the pandemic situation is sort of grave. And also the units of early childhood care have been open the whole time. They were closed too in spring 2020, but soon after that they were reopened and have been and remained open until that. In Finland also we took care of the upper secondary, the matriculation exam and the graduation, the students who were about to graduate and those kind of things. I think the local authorities still have the power to sort of make the decisions on whether some schools, whole schools, must be closed or kept open. And that can be that in one school we can have one class that is in the quarantine situation and another class that is present. So the situation varies from, I would say, from school to school very much. But there are no more government decisions at the moment.
Děkuji.
Thank you very much for the comments on the situation in Finland. The interesting thing is that initially the decision-making power was with the government, that is on the top level, but later in the autumn last year, this decision-making power was delegated to the local level, and the decision-making is based on the immediate situation at different schools. We again heard about the priority given to primary schools. We also heard that preschool facilities remained open almost all of the time. And you also mentioned that pupils with special need who would find it probably very difficult to follow distance learning were left at school physically all the time. Deputy Minister, we have been discussing for a long time why it should be schools in the Czech Republic that bear the burden of the pandemic for the longest. Because in the Czech Republic, schools were perhaps made victims of the pandemic. Obviously, it is much easier to close down schools rather than make arrangements with manufacturing facilities and manufacturers to adopt some measures. So what is your view? Since March last year, since the first information about the pandemic, we had to make it clear whether it was the responsibility of the Ministry of Health or whether the powers that the Ministry of Health had would be sufficient to tackle the pandemic, or whether the emergency staff should be activated, or whether the management should be in the hands of the government. Then eventually the emergency staff was not activated last spring, and the government took over the crisis management. And one of the first measures, also due to the lack of information about the spread of the disease, was to close down schools back in March 2020. And perhaps this was the first handicap. So in the Czech Republic, unlike in many other countries, we managed to keep the pandemic at very low levels in the first wave. However, during the following waves in the autumn and this spring, the same approach was taken, so the schools were closed down as first. We have not been able to change the mindset. We wanted to let primary school children to go to school, or at least to open schools for children with special needs. We had examples from abroad. That was our effort to explain and that special needs schools should remain open. For quite a long time, we were able to keep preschool care open and subsequently also the first 2 grades of primary school. However, in the Czech Republic, the period of school closed down was the longest. At the moment, still secondary schools are not fully open, and the same applies to universities. This week is the first week when the higher grade of primary schools are open, even though in rotation turns. Only next week, the whole primary schools will remain open without any rotation. So the school system and the schooling program has been affected and impacted enormously, probably much more than in other countries. We have been unsuccessful in trying to promote opening the schools earlier. Thank you very much for assessing the situation in the Czech Republic. I must mention that actually even preschool facilities were completely closed for some time. So the entire schooling system was out of service. We have already heard one topic in all of the contributions, and that is inequality in access to education in education. It is one of the crucial topics. The Czech Republic, in international comparison, is really lagging behind. There is quite a lot of inequality in access to education. So there are strategies by the government that should address this topic. In any case, as we have already mentioned several times earlier, the pandemic made the problem more visible and perhaps even contributed to increasing the problem. Those who survived well and who could cope better may be later more resilient, but still we have the other end of the society, children who do not live in convenient and favorable conditions, and these may suffer from a greater impact of the pandemic, and we are still unable to foresee the impact. So how do you see the post-COVID situation? What happens once children go back to schools? How are you planning to address the inequality in access to schooling? Do you have any plans in Sweden? Could you share it with us if there is such plan?
I don't think it's a written plan, national. Of course, we know that it's a huge problem, especially by the secondary school that has been digital for over 1 year now. And the government has increased the budget for the locals, so they could increase the number of teachers and other persons who work in school. But I'm especially afraid of the health. with the young people. I think we also have to have discussions in groups and with one to talk about how do they feel after this year, what do they have for needs one and in the class. So I think we have a big work to do at every school, and as someone of you said before, we also have teachers that are very tired. They have worked very hard this year. So we have a big challenge if we shall lose our young people. We have to hold and have that on priority, I think. Yeah, thank you.
Zejména pro
In particular for secondary school students, the situation was really extremely difficult as they spent much more time with distance learning, and they are still not young adults as university students. And their mental well-being could be affected, of course, depending on the situation in which they live. And this is a huge task for schools that will have to deal with the issues of young people at the time when teachers are extremely tired after going through a difficult period when they had to move into online learning, which of course is related to the communication using digital platform. Professor Rittman, how do you see the issue of inequality in Estonia? And what, in your opinion, or how, in your opinion, pandemic measures actually affected this area or even deepened the problems and issues in your countries?
Well, I think that I have to agree with my colleague from Sweden, because the most widest problems perhaps will be visible a bit later, but they will be just psychological problems, because students need to communicate, and they have been forced to stay at home. And though there are lots of communication possibilities through internet, it doesn't replace the real communication between young people. With the more younger one, our government has decided to have summer camps for children in order to give them the possibility to play outside, and sometimes, if needed, also to just take an overview of some problems they had in learning. But the most and the main idea was that students and children could be outside in summer camps and could communicate and could play and could be children. This way, we'll have to with time management. They need help with self-regulated learning, but and also there have been psychological problems also mentioned. So I think we can see those problems a bit later, but we have to deal with them at once.
Paní profesorka Rittmanová souhlasí.
Professor Rittman agrees or sees the issue similarly to Gunilla Svantorp, and that's the major burden will be reflected in the mental health of young people. But she also mentioned that there are certain proposals how to deal with this situation, for example, through summer camps for children. Mr. Helminen, how do you see the issue of inequalities and COVID through your experience in Finland, and what steps will follow after the situation calms down and become normal again?
I must agree with the points mentioned in the earlier speeches about this. We are concerned about mental health issues for students, younger and older. We have seen a situation where hobbies and sports have also been in total lockdown. So at the same time, when, for example, upper secondary student loses the school community, friends, and the support of the school community, and also loses hobbies, for example, football or any other sports or hobby. So that must have some effect, and as said, the effects will show a bit later, I'm afraid. Also, the same problem of inequality as mentioned in Sweden is that the socio-economic background of the home affects learning and the capabilities of the children so much. So that's some kind of a fundamental inequality factor that we have to deal anyhow, regardless of the pandemic situation. That's a development that must be addressed somehow. Also, in this situation, we are the government is giving financial supports to schools to organize to sort of to hire staff, for example, school psychologists and specialists. And it's sort of a short-term remedy for trying to cope with the situation. But later on, I can see that we must be able to invest more in the school system, in sort of the support functions of the system, like school psychologists and other healthcare specialists that are in schools. We have too few of those specialists. Also, what I'm a bit worried is the burden of the school is increasing all the time. The school system cannot take all the burden of the society. So the place and the role of the home, even if it's difficult, we must do something to try to sort of engage the homes and parents more in a sort of constructive way.
Děkujeme.
Thank you. The need to increase investment into, let's say, psychological help at schools, that's one thing that is needed at the time where we will deal with the effects of long-term distant learning, when young people, students, were isolated from their normal lives. And it does not concern only schools, but also their leisure time activities or sports activities. And that also means reduction of their community lives that they were used to. Also, Mr. Helminen points out that the trend of increasing burden for the schools, for example, in the area of mental health, is a burden that they cannot cope with on their own. there must be a whole society solution found with the primary role also played by the family and home environment of the students. So it's a question of a more comprehensive approach. Deputy Minister, our three international guests have agreed that the biggest problem that we will most probably have to deal with would be the mental health and mental condition of the students. What is the position of the Czech Ministry of Education? Do you believe that the government is aware of the fact that perhaps there will be a need to increase capacity in the area of psychological help or other support services? Will there be enough funds available in post-COVID time? We do have the information. I am a member of the Council of the Government for Mental Health. We had data from the spring wave, and we see that there is the increased sociopathologic behavior, misusing drugs or alcohol, etc. So we know that we need to support the role of school advisors or psychologists. And we prepared a short training program, about 20 hours for these roles, so they could cope and respond to this situation. I believe that the Ministry of Education would focus more on the losses related to gaining knowledge, but the losses in the area of the social behavior is also enormous. And we heard that also leisure time activities and sports activities were in a lockdown, and for students and for pupils from families that do not support these students in their leisure time activities, we would need to support these activities even more by the state. I just can't imagine any other model than, children living in a difficult family situation would need to be more involved not only in education, but also in these leisure time activities. Originally, we planned sort of summer schools in summer 2021. But then we changed the approach and wanted to make sure that children could spend time together, play together, and we wanted to get as many children involved as possible, and we reduced the learning aspect of it. And I expect that for 2021, we would focus more on sort of targeted summer schools that would be more like summer camps, but there will be also the learning aspect that would be targeted on certain disadvantaged groups of children. Also during the school year 21-22 and then 22-23, so we spread it to 2-year period. Maybe we will spread it to 3 years. We have a targeted support for primary and secondary schools. We would be adding additional classes that would be covered from our budget so that students that lag behind would be able to attend these courses. And it will be very individual, based on the situation at individual schools and students. And we are also thinking about how to help the schools with equipment and devices. What we actually manage in order to improve the whole situation was to get extra funds from the state budget for IT equipment. And now we received statistical data back, and we know that about 45,000 mobile devices, whether we talk about tablets or laptops, were actually lent to pupils and students who did not have these devices. So that was a leap increase. Of course, we did not start from zero. The schools were lending devices also before that. But that means that access to digital equipment improved, and also it's important to motivate and stimulate children. And that could involve also work of NGOs, leisure time activities, also organizations founded by municipalities. So we need to get the children engaged in those activities that they like and enjoy, and that will lead also to more engagement in learning. I think that many groups through sports activities, technical activities and arts will engage the children more, and children will spend more time at the premises of schools.
Thank you for explaining about the plans for post-COVID education and changes in the Czech Republic. Let us move to the last area, which covers the digital skills, that is, skills to actually use the digital technology and tools. The need to start distance learning basically overnight was quite a burden for everyone. At the same time, it has brought the impetus for increasing the digital skills both among teachers and pupils. Yet, still after the year, it would be naive to think that distance learning could serve as the only educational tool. Social contact and communication, physical contact is irreplaceable. Yet, digital learning or remote learning will remain present in one way or another. It is more suitable at higher educational levels. The question is where to draw the line between the suitable and non-suitable extent. Where do you see the role of distance learning in the standard learning and schooling process? One of the questions that came from the audience was whether digital learning and digital education should be part of teachers' training. Do you have this as a part of teachers' training in your respective countries, and perhaps how it should be enhanced? Let us start again with Gunilla Svantorp.
Thank you. I think it's very important that the ability to use digital tools will be more important part of the teacher education that it has been until now. I think it's very important. But I also think that it has to be the teachers who decide whether they should use it or not, because it's not just giving the pupils an iPad or a computer, because you also have to use it in the right way. So I think it's very much a question about the teachers' needs and demands. But in higher education, I think it's a very important thing that we can offer higher education all over Sweden. We have areas that have a long way to go to the university or high school. So, and could we then use the digital way to come to the pupils and the adults instead of they are coming to the universities? That's the right way to go, I think. Thank you.
Ve Švédsku
in Sweden, it is desirable to use digital learning where the physical presence is more difficult. There may be remote regions where physical access to universities or other tertiary education facilities can be quite far away. So there it may be very convenient to use the newly acquired digital skills to have access to online education. As Mrs. Van Top said, it should be left to the decision of teachers whether or not and when to use digital learning. However, this would require that the teachers are well aware of the digital tools and know well when and why they want to use the tools. Mrs. Rytman, from your experience from the university environment and elsewhere, how do you think the digital skills training should be supported, particularly in training of teachers?
Fortunately, we already have had digital training for teachers for more than 10 years in Estonia. So they have digital training in their master studies and later in continuing education. But yes, in today's situation, I think we will have to pay more attention to this. From the other side, at the universities, we also have continuing education for the faculty members who teach. And that means they also get the knowledge how to use digital tools. But I agree with the idea that the teacher will have to decide, because it depends on the course content, on the subjects, on students, on what level they are, and are they able to use digital tools. And in this case, I think, yes, digital education has come to stay, especially on the level of universities and in the level of theoretical teaching. But I think that elementary school and general school should learn more in a real environment and learn from each other and work together and communicate. So we have to use it, but we'll have to balance and use it wisely.
Paní profesorka.
Professor Rytman agrees that, again, it should be the decision of teachers whether when to use digital tools. In Estonia, it is not such a big problem because Estonian teachers for some time had already been trained in using digital tools, and there are also programs for teacher training, also postgraduate. So it can be easier in Estonia. In any case, it is more important to respond to the needs of real time and to take the experience and take source of information in the real time, and only then use it in digital learning. So what is the approach to the use of digital tools and digital skill training among teachers in Finland? Will the Finnish National Agency for Education promote the extension of this learning, because you are the agency that helps the school in this respect. Mr. Helminen.
Yes, in our universities, the digital pedagogy and the use of equipment is more or less integrated in the curriculum, and is, I think, developing in the right way, small by small steps. I think we are going to see a good situation in the new teachers that are coming to the profession in that sense. For the digital skills, we have launched a government program for new literacies, and we have published national guidelines, not obligatory, but to be applied at will for schools, that describe quite in detail, actually, the digital skills for students, for pupils, in ICT skills, media literacy, and in programming. So these recommendations or guidelines are being piloted in the fall, next fall, and we are gathering experience and knowledge and research on that, and we are then hoping that these guidelines will sort of make the situation more even in Finnish schools, and of course this applies to the teachers, of course, very much. So the student skills reflect directly to the skills of the teacher and the skills of the whole school community. I agree that the use of digital tools and digital pedagogy must be the decision of the teacher. Also, for equality reasons, we need the school community to work together and make sure that the children and students, pupils, get the whole pack of skills when they leave school. So if every teacher decides that this is not my thing, so the student is left without skills at all, or has to acquire them otherwise. So we are really much trying to struggle with this situation in Finland.
I pan Helminen souhlasí.
Mr. Helminen again agrees that use of technology is the choice of the teacher. However, in respect of treating inequality in education, is not really in resolving the situation of a single teacher or a single family. It is a role of the entire community. In Finland, as we have already heard, there is a long-term survey going on in Finland, and the outputs of the surveys also can be used for this purpose, that is for guidance on how to address digital skills both in teachers and in pupils. So the last to comment on the approach from the Czech viewpoint will be Deputy Minister Kovář. We certainly cannot say that we would have a robust survey and that we would have a well-developed digital training among teachers. Yes, the level of digital skills in the Czech Republic is not such as in Sweden, for example, and the COVID pandemic focused a spotlight on this shortcoming. I think that particularly at secondary schools, during optional substances, we could use distance learning, where we could join students from various groups. For individual trainings, distance learning or digital tools could also be very suitable. For example, for a student who is long-term abroad with parents, or for top sports students who have a lot of sports training or long-term sick, for example. Another aspect at university level is that we saw that there are certain parts of the training or learning that could be easily taken remotely, and there are other areas where it is obvious that physical presence is necessary. So perhaps we got a better idea about what really needs to be done physically at school and what can be done remotely or individually by students. And perhaps later on we will have the structure from universities also transferred to secondary schools. There was quite a mental burden imposed on students during the pandemic. And we also got a certain exceptional experience from the pandemic, from using the digital tools, and this will be an opportunity for us to develop it further on. I would like to thank all the panelists for their interesting contributions, and I hand over to the center again.
Thank you very much. And before we start with panel number 3, we have yet another VIP talk on the topic how to minimize the impact of coronavirus on the digital economy. And it will nicely follow on the previous panel, as it shows that education is a sort of a multifaceted expertise, and we need to make sure that everybody goes through lifelong learning. But we'll hear from Rebecca Christie, visiting fellow think tank Bruegel. The floor is yours.
Rebecca
Hello,
Christie.
thank you very much for inviting me. Can you guys hear me? Hooray!
We can hear you.
Digital economy is a wonderful thing. I so wish I could be with you in person today, but instead I am able to speak to you in real time thanks to these marvelous platforms. I'm here to speak to you about the recovery after the pandemic, and specifically how it relates to the digital transition. What we want is to build an economy that is stronger and more resilient than the one that we had before the lockdowns, and that also takes advantage of the strengths that we used to get through it. As we see, technology has held our communities together. It's protected jobs in a way that would have been much, much harder even a few years ago, because when the lockdowns hit, many industries were able to just shift to remote work. They had the computing infrastructure, they'd been making the investments, they had a workforce that knew how to use it and was comfortable making the switch. That combined with the existing personal connections that people had. So they knew who they had to talk to, they knew what they had to do, and they had the tools to do it. For some people, the people whose lives had endless travel or even more endless commuting, which is a big deal in places where housing is expensive, it's been great to be home. Less time on the road, more time with their families, more ability to focus on the substance of their work. For other people, it's been a severe challenge because of childcare responsibilities or because they haven't been able to manage without these connections to the physical world, supply chains, daycare, things of that nature. This suggests that after the pandemic, there will be a mix of remote work and in-person work. There was a study at Stanford University that said for the US, they predict about 20% of US work will stay remote when it's safe to go back full time. It's 2 days out of 5. That's sort of feels right, doesn't it? It's a lot more than the 5% we saw in the before times. For digital nomads, some of the highest skilled and most online workers, there might be even more incentive to stay out of the office more or less indefinitely. But for other countries, it's a lot less clear. Many parts of the developing world don't have widespread internet access. They don't have jobs and industries that they can move online. And they may not have just the basic infrastructure to get through a disaster of this magnitude. We're seeing now in India, this can be catastrophic. Healthcare, hospitals, electricity, water, oxygen. These are things that are very difficult to manage without, even before you talk about 5G broadband access. So as we grow out of our pandemic recession, we have to be mindful of that, because we've seen that a problem such as COVID-19 doesn't respect borders. It's not a thing we can seal ourselves off from. And even as we take shelter in our homes and our internet connections, we have to be mindful of how that fits into the rest of the world. A less than global response will not work for a global crisis like this. I see 3 I's as being essential for where we go from here: inflation, immigration, and inequality. Inflation is the one that economists like to talk about. When people see inflation getting too high or too low, with rising prices or negative interest rates, they start to worry. We saw in the EU spring forecast yesterday that for the entire EU, inflation is predicted to be around 1.9%, with some of the biggest jumps coming outside the euro area. Some of this is temporary because of transportation costs or energy costs or other things. And some people would say, oh, it's time to worry. Inflation's going up. We can't just keep spending and borrowing. My view is it's way too soon to panic. A little bit of inflation can help the economy. And the EU forecasts show that it's expected to come down next year and probably going forward, at least until unemployment starts to improve. As long as there are still these really big gaps in who can find work, who needs it, it's not going to keep inflation going up out of control. So that's the thing we have to keep in mind, because if governments pull back their supports, if they stop spending because of a theoretical inflation risk, they face a very real risk of taking out the supports that have kept the economy going through all this. They lose the investment in the infrastructure. They lose the momentum. They lose the temporary support to the industries that are having trouble in these times of isolation. And that's much more dangerous than some sort of theoretical economic risk. Now, inequality is a bigger deal. As we were talking about, the workers with the highest paying jobs are doing the best. They've got savings. They may even be doing better than they were before because their financial market investments have been doing better. The EU, the world's second largest economy, has certainly benefited from some of this created wealth. But there's also been this huge, unprecedented recession. In 2020, the EU economy fell more than 6% as a whole. And in France and Italy and Spain, it shrank 8%, 9%, and 10%, respectively. Those are big drops. Even a lot of economic growth to come is going to take us a while to dig out of those holes. Millions of workers around the world have lost their jobs, have been affected, and many others are only going because of the supports they've gotten from their governments. So you look at that and you look at the shocks in the developing world. The workers are losing their livelihoods. The children are losing their access to education. These divides can spread. So for those of us, those countries and societies that have the resources to keep investing, we need to keep doing that. And we need to keep looking around the world to see our place in that, not just at home. I'd like to quote Dr. Mokisa Kitui, who is the Secretary General of the UN Conference on Trade and Development, who says, the risk is that these huge digital divides that already existed between and within countries will worsen in the wake of the pandemic. And that will mean even deeper inequalities. It seems obvious, but now as we're all only seeing the same 5 or 10 people in person every day, it can be hard to hang on to this perspective. And that's where the last I comes in, immigration. Immigration is a mindset and not only an economic issue. Even before the pandemic, we saw a lot of countries talking about foreigners, There was some populist scaremongering. It was a good way to differentiate between them and us. But at the same time, especially here in Europe, we got used to crossing borders. We got used to being able to visit each other, to talk to each other, to learn from each other, and to take advantage of the wonderful resources that we have across the single market. With Brexit and the pandemic, that freedom has really come to a halt, and reopening our borders to short-term travel, to longer-term postings, to being able to get residency again. This will be an essential part of helping the European Union reach its economic potential. Every aspect of the economy is affected by how either connected or isolated we are from each other. Promising students need to seek out the best educations in their field and not be stuck with whatever they can get access to locally. Even with remote learning, it's important to be able to talk and see and meet new people. Companies need to be able to hire the best talent. They need to be able to integrate it into their existing workforce. And cities and countries need to make sure they can find enough doctors and nurses, sanitation workers, people who can't work remotely, people who need to take on these many, many jobs that are essential to the way our society functions. Global supply chains need to come back. Producers need to be able to sell to the businesses and consumers who want things. We see that it's not enough to just hope that the supply chains hold. We have to invest in that, and we have to work on that. And making it easier for people to move around and to understand each other. That's something that migrants really bring. They bring an understanding of how different places work that is essential for keeping these connections going. We need automakers to be able to scale up. We need automakers to be able to hire the workers, and we need them to be able to sell their cars so we don't get a situation like we have in the US right now, where lots of people want to buy cars or rent cars and they can't find them. Immigration doesn't have to be a scary word. Migrants aren't scary people. Some of them are coming from the world's poorest countries, looking for a place to work hard. Some of them are coming from the world's richest places and looking for a community where they feel comfortable and where they can really make the most of their talents. And a whole lot of people are ordinary folks trying to strike the right balance. So to bring it back to the digital economy, cities like Prague, with a long history of welcoming expats, can really capitalize on this mobile talent if they were willing to keep the doors open. But if nationalism or public health snags end up getting in the way, communities may end up slamming these doors on their own feet. So public health will be very important going forward, coordinating it locally, nationally, internationally, globally. We have seen unprecedented solidarity here in the EU with the Recovery and the Resilience Facility and the budget that is coming with it, the joint borrowing. This is a very big deal. It will pay benefits for many, many years to come. And we also see that technology has helped specific sectors like the pharmaceutical sector, which has developed vaccines in record time and is now producing them and trying to distribute them and get them into the communities where we need. Going forward, we need to keep this momentum. We need to not fall back into old habits of caution and austerity. We don't want to subsidize the past and failing sectors. But right now, in the middle of this crisis, it's very hard to tell who has become obsolete and who is struggling but can really make a contribution once we've gotten through the worst of the crisis. So it's too early to pull back the supports. And the digital transition really gives us an opportunity to reach out, make the connections where they're there to be made, strengthen the ones that are there already, and support the things that have to be done in person. And I hope that we will find the strength to use it. Thank you.
Thank you so much for sharing that with us. Děkuji moc.
Thank you so much for this VIP talk about minimizing the impact of coronavirus on the digital economy. That was Rebecca Christie, visiting fellow think tank Bruegel, Belgium. Now, the panel number 3 is ahead of us, talking about intelligent urban mobility for the 21st century.
Infrastruktura, logistika a mobilita, to je něco, co se...
Infrastructure, logistics, and mobility. This is something that has been addressed thousands years ago. Even in the ancient Rome, you had to resolve how to get from one end of the city to the other. In Prague, we have a similar concern, and digital tools can contribute to improving our mobility in the city, our feeling in the city, and we need intelligent tools to make our mobility intelligent, smart. We have panelists on the third and last panel of our conference. So thank you for coming and for joining us for this particular panel. Our guests are Martin Kolovratník, Member of the Parliament of the Czech Republic, Vice Chairman of the Economic Committee, and Vice Chairman of the Board of Directors of the Railway Administration. Welcome for invitation. Franciszek Czerczewski, Member of the Sejm of the Republic of Poland, Member of the Infrastructure Committee in the Polish Sejm. Bohdan Vojnar, former President of the Automobile Industry Association of the Czech Republic, Member of the Board of Directors of the Confederation of Industry and Transport of the Czech Republic. Miroslav Svítek, President of the Czech Smart City Cluster, Member of the Scientific Board of the Czech Institute of Informatics, Robotics and Cybernetics, and the Dean Emerite of the Faculty of Transport of the Czech Technical University. And last but not least, Ruth Bízková, the former Minister of the Environment of the Czech Republic, former Chair of the Technology Agency of the Czech Republic, and she is going to moderate the panel. Welcome, everybody, and I'm looking forward to your discussion. Thank you. The role of a moderator is a bit difficult for me. I talk perhaps too much for a moderator. Let me start with an opening comment. On Monday, the government approved the strategy on smart cities. And unlike many other European countries, we do have now a national strategy. And the content is that it's not sufficient to have smart cities, but we need a complex smart environment, smart regions, and eventually smart Czech Republic. If the country has to be smart and sustainable, and the terms developed over time, in any case, if it is to be convenient for the lives of citizens in the 21st century, all the elements have to work together. The document that was approved by the government was based on the first smart concept, which was also developed by Miroslav Svítek, who used to be the guru of the smart city concept. Then the Ministry of Transport used to be the first ministry where the smart concept was adopted. So, Mr. Svítek, could you, for the start, explain what it really means having smart urban mobility? Is there only smart urban mobility or other mobility? Thank you for the invitation and for the opportunity to be the first to mention or to talk about smart urban mobility and logistics. These two areas are closely interconnected. I will start perhaps in a slightly different way. We teach our students that the best transport there is no transport. So actually, even urban transport should be based on the actual needs of the users. That is why we also often use the activity-based models, where we try to identify what people really need, what type of transport, when, in what extent, and only after we have the demand for the transport well mapped can we offer corresponding and adequate services, and only then can we develop smart mobility. Quite often, the demand for transport can be addressed in a different way than we thought. We have learned over the last year that you can do many activities, including work from home, and of course this will be reflected in demand for transport. Smart mobility has a methodology. Our cities will know their sustainable urban mobility plans. Majority of the towns have developed their own dedicated plans of this kind. I was lucky to be involved in a European project which contributed to developing the methodology for other cities in the Czech Republic. And if you look at the web page of the European Commission, you can find that there are many cities across Europe that have actually developed plans based on the European guidance. And it is the very basic document for designing smart mobility. And that the basic idea is that first you have to map the demand, then you can design the smart mobility to fit it. In the past, we had offline vehicles, then later on they became integrated into services. Today, we have vehicles as a service. We have shared vehicles, and there are many more companies now coming up that offer this type of service. So mobility, similarly to telecommunication service, is perceived as an interconnected and shared service. And this is actually the feature of the fourth industrial revolution. People are interconnected through networks and similarly the components of the smart city are interconnected through the infrastructure. And there is a possibility for communication among all the elements, and this creates big data, and artificial intelligence can use the data to optimize the models. So this is the basis of Industry 4.0. It is, in a way, individualized mass production. In the past, this would have been impossible because it would be environmentally absolutely implausible. But today, mobility as a service tries to use all the available big data and offer the best possible public service to urban users. We are trying to devise a dynamic public transport service system. You have a backbone system which is fixed, but the transport at the outskirts in suburban areas is and can be rather flexible. Since you can individualize the last mile transport, you can really adapt it to the actual need. And using the smart and new technologies, you can try to accommodate the demand of most users. In a way, this reduces the demand for individualized automobile mobility. We have been part of the MAVEN initiative, and we mapped a situation how the cities would look like if autonomous vehicles were present in different proportions in cities and how they would interact with non-autonomous mobile devices. Actually, this type of surveys is a great opportunity for our university and many other institutions. This is just to show you the examples of autonomous mobility. This is actually not a passenger vehicle, small passenger vehicle, but it is a minibus that drives through the city of Zion in Switzerland. It is used for tourists and also for students within campuses, and it is operated by Swiss Post. Smart mobility is closely related to modern and advanced technologies. The mobility and the transport can rise higher. These are sort of pod cars, as I call it. They are able to autonomously transport passengers from one place to another. And you can see that even in a congested city, you could use this type of transport easily. These are examples of city logistics. You could have this autonomous delivery of your pizza or of your parcel. This type of autonomous vehicle would have its own sort of intelligence. It would be able to wait at the crossroads, wait for the green light, and continue only with the green light. So there are numerous technologies that can be used, and all of these can be used in urban mobility and city logistics, but they will require additional networks for security, safety, and so on. And this is a type of a visionary project that autonomous vehicles could be all kinds of vehicles, so even drones that might transport people. This model was tested some 2 years ago in Las Vegas. So this is also something that has to be taken into consideration for the future. My last slide here illustrates that each city develops its own living laboratory for their own smart systems. We selected Evropská Street in Prague from a large roundabout up to the airport. In between, there is also a railway junction, which should soon become sort of an entry hub to Prague with transport from the airport. There is also a metro station, underground station. So at this segment of the long and busy road, we are planning numerous tests of the logistics and urban mobility. All of these concepts have to be tested in a small scale before they can be implemented on a larger scale. So this is our vision of how we would like to test smart urban mobility in Prague, and this is our approach. We are happy that we have been heard and found partners at the airport, because their input will be very valuable. So this was my first presentation to open the debate. Thank you very much. If you are successful with your project of the small segment, I live not far behind the airport. I have hope now that I actually might get to Prague with a train. The project of this segment of the Evropská Street is supported also by the Czech Technology Agency, and it would be a really good model project. You actually made a bridge for Mr. Kolovratník. Mr. Kolovratník, you have been introduced, but not fully. I read that you have a background education in transport, firstly of all, and also you are on the board of the Railway Infrastructure Administration. When talking about mobility, we talk about cars, we talk about drones, but sometimes the railway transport is left aside. But particularly in Prague and its near surroundings, for many people who decide to live outside Prague, they may use railway for transport, because even though it has proven that in certain cases you don't need to travel to Prague at all, but now you can see that people ask, is there a railway connection to the place where I want to live, not bus? And we realized that the last mile transport is extremely important, and people assess whether they will need a car for the last mile or not, whether they can have their beer after work in Prague.
Prezentaci nemám.
Thank you very much. I do not have a presentation, but I'm the person who likes to have a beer after work, so I would definitely look for a place with railway connection. You have opened, perhaps not a Pandora box, but many interconnections, and we here at the conference called Digital Czech Republic that discusses many actually topics, and digital transport is such a wide topic that we could discuss it for 2 days, not only within one panel. Yes, I am the member of the board of directors of the railway administration, and we have until 2028, and we will definitely live to see it. I'm actually a graduate of the transport faculty in Pardubice University, and I graduated in 1998, and it's so long time ago, and so many things have changed. So I will be the devil's advocate here. Not perhaps an opponent, but I would like to challenge and ask some question. So I am a member of the parliament from Pardubice, which is a region about 100 kilometers away from Prague, so I use railway a lot. I am not happy with the mobility because in order to save time the last mile, I use my diesel car to actually get to the railway station in Pardubice, which is the worst thing I can do. And apart from being a member of the parliament, I also a member of the regional administration and the municipal administration. On one hand side, it's wonderful to see those car pods and those driverless buses. But then I see the reality, and I'm a fan of new technologies, and I will never buy anything online. And then it goes back to the decision-making of railways, Czech railways, in terms of how many cashiers they would need to have at railway stations. And the same applies to road transport, smart highways, testing of cars. Again, it gets back to me. The age of cars is about 14 years, so that's statistical data, but you have cars that are 20 years old with an old emission norm, and the owners are happy to have them. And when we started a discussion to increase the fee for emissions in order to have younger cars, it got back to us politicians that would be to the detriment of the poorer people who do not have enough money to buy new cars. So I need to look at the purchasing power of our inhabitants and to decide whether they can afford it or not. And the second question that I want to ask also co-speakers is who should be responsible for that? You said this wonderful piece of news that the government came up with a new concept material. I see it in transport. We have those IROPs, transport, and through the Technological Agency of the Czech Republic, we have many projects, but I'm also a member of the supervisory board of the transport company in Pardubice. When I go back to municipal mobility, these projects are actually linked to transport companies, such as sharing a location, etc. But in reality, I see that it's totally different in every single city and municipality, that every single city takes their own individual approach. A different system is in Brno, in Pilsen, in Ostrava, in Pardubice. We have a project of smart crossroads. That there is information sharing about the green wave, but it's different in every single town and city. We have organizations such as the Association of Transport Companies. We have the Union of Towns and Municipalities, where they share information, and we do not use the potential of interpersonal communication and coordination by actually inspiring ourselves and also introducing common standards. Yes, thank you very much. Yes, we, and I say we, because the material that was adopted by the government was submitted by the Ministry of Regional Development. And I know that Professor was also in the governing, the steering committee at the Ministry, or at the Union of Towns and Municipalities. Yes, unifying standards, that's important. And apart actually larger towns, no one has the capacities to deal with everything on their own. And then we might ask, what is it good for? I have also a COVID response that it's always difficult for politicians. It's clear because there are many different voices coming. But, people were saying we can't have e-prescription, sickness leave record. But then, you find out that everything is possible. And I think that after COVID, perhaps hopefully, we will make this leap closer to digital technology. Perhaps I will actually respond quickly. Today we have Vladimíra, the Chief Digital Officer. On my behalf, I can imagine to have a similar person for transport, just for transport, a person who would be the integrator. And perhaps this idea could inspire Minister Karel Havlíček now, or perhaps after the elections, that we could take this path. Okay, I'll take note of that. We will do the implementation plan, and this, I think, should be something that we see at all the ministries or all the sectors, because it's up to the sectors how they respond to what the government does and how we can integrate it. So what they should do in order to work it in the field. So it's good that you said that. Thank you very much. And we will try to work with that. So after these first Czech experiences, I will turn to our colleague from Poland. We have Franciszek Sterczewski, who is the member of the Polish Sejm, and he's the member of the Infrastructure Committee of the Polish Sejm. So could you please do your first introduction, general Polish position, and after the experience with COVID that we have?
Ahoy there. It's so great to see you and to join you in this discussion. I don't know if you're hearing right now, if everything works, but after this year, after this year and a half of pandemics, we all have seen what was happening in the transport sector and how it stopped in many cases, how public transportation was enabled in many situations. I'm not sure how it was exactly in Czech Republic, which I admire for České dráhy and for your great railway system. But in Poland, it was a really difficult situation. So people were really afraid of using buses and trains but not everybody could work online. So it was a big struggle how to go to work and other directions. So I've been following what was happening in many places around the world. What did Paris, what France did, what was happening in Berlin, Vienna, and so on. And I was really inspired, and I was really jealous how I looked to the shift for the bike infrastructure, and it was really inspiring. And I think that's the main direction. That's the main chase we should continue to think to focus on this kind of mobility that is safe and that it's most effective, that can help people go wherever they like, whatever they need, and as well that is good for the climate, because right now, after the pandemics, I hope it's getting finished, but right now, first because of the pandemics, because of the economical crisis, and because of the climate crisis, we are on the turning point of our history, and we really need to think or rethink what is smart, what is the smart city, what's actually the sustainable mobility. And I really did like the previous presentations, and there and I know we have to think about autonomous mobility and about reshaping the car industry and so on to make it more electrical and so on. But for I think that the main goal is that we should focus on the public transportation and on bike transportation, on everything that can help us to decrease the greenhouse gas emissions, and that can help us to achieve this 1.5 Celsius goal that UN IPCC reports show us that we have to do it if we want to have any future on this planet. So we have it's a wide debate, and we should all talk about it. And transport is really an important subject in this whole in responsibility for the greenhouse gas emissions. But so I'm really happy that we see the shift and the change of the public on the transport priority. For instance, in the United States, thanks to Joe Biden, that is financing the huge infrastructure projects for the railways, for the public transport, for the Amtrak as well, the company that Joe Biden used for many years to go to the Senate. So we have to join this this path, and in Poland for the last year we've seen this idea, this approach in many cities. Many cities started to found, for instance, cargo bikes or invest in bike infrastructure like Krakow, like Triple City, like my hometown, Poznań, which I hope to see you once in close future. You have the invitation already. But I see as a member of the parliament that we have not enough support on the national level, and that's the goal we have to change. And I hope we'll change that in the close future, because as I've started that, I look to the Czech train transportation system, to German and many great examples of how a railway system can develop the region, the city, the country. And Poland have a big lesson, big gap to fill and to reach your level. The pandemic is just the occasion that is showing how much we have to do. We have to change in our approach to make our cities and our country more sustainable, more safe, more pro climate, and I think that's the thing I try to do, and I try to focus on every level. So when I was going to the parliament, I was also.
Už když jsem vstupoval do parlamentu, tak jsem propagoval železniční dopravu. A vytvořil jsem si hashtag právě na tuto podporu, který parafrázoval Make America Great Again, čili já jsem použil slogan k obnovení skvělé veřejné dopravy. I ve Spojených státech ministr dopravy použil podobný hashtag a já jsem si to tedy vzala za své a
Sorry for the long talk and thank you.
No, děkujeme mnohokrát. Trošičku se nám teď asi ten přenos zastavil.
Thank you for your contribution. Unfortunately, the end of your contribution was sort of blurry, but it was a challenge for this conference as well for many other conferences, because what we need is safe and reliant infrastructure. Thank you very much for your invitation to Poznań. Last year, during the East period, we spent some time in Poland with my husband. We also visited Poznań, and I saw an excellent art exhibition there. Poznań is really a beautiful city, and the exhibition was fantastic. And what you can see is that there is a great spiritual potential present in the city. So my congratulations, and I hope one day we might meet there. And of course, you are invited to Prague too, and come by train, please. So thank you for your initial remarks. I personally saw autonomous vehicles myself at Skoda. They do use autonomous vehicles for internal transport. Some time ago, when I heard about autonomous transport for the first time, I asked Bohdan Vojnar, who is the chair of the Automobile Industry Association, and he is also on the board of the Confederation of Industry and Transport. I asked him whether autonomous transport would be available in near future, because it would help a lot to the suburban areas and to the rural areas, because the Czech Republic has many small municipalities in rural areas, and it is highly dependent on car transport. Mr. Vojnar was rather skeptical, but much less than the then Minister of Transport. So what is your current view now? Good afternoon. Greetings to Prague and to Poznań. I am no more a president of the Automobile Industry Association, but I am still on the board of the Confederation of Industry and Transport. Let me mention some 4 or 5 aspects that we have to take into consideration in the respect of the post-pandemic transport. We need to bear in mind that the economic situation on the market plays an important role, and we see big differences between, for example, the US and China. So there are large regional differences. That means that OEMs and suppliers will have to rethink their business models and investment patterns. There will be also more pressure on the investment decision-making. With this, there is a great need for automobile manufacturers to use software in wider range. Software becomes much a larger part of the vehicle equipment than it used to be. And cybersecurity becomes a major part of the whole ecosystem as well. And we should also ask to what extent have we been influenced by the climatic change? So whether it is going to happen and whether it is really going to be the booster of all the changes that we are talking about. Also, Bill Gates, in his last book, puts COVID and climatic change into a correlation and to interlinking. So we hope that we will not repeat situation that happened after the crisis in 2008. As for the autonomous vehicles and about how far we have progressed is quite appropriate. My opinion is automated system and autonomous vehicles will appear in different areas. They will respond to very specific requirements. So it might be difficult to scale this system up to larger, massive use. Mr. Svitek mentioned that in numerous cities there are already pilot projects, level 4 pilot projects, in which we are able to move either people or goods using autonomous vehicles. But as for the level 4 projects, and there are up to 6 levels of the use of autonomous vehicles, this level 4 still requires certain human interaction and intervention. And the proportion on the market to be expected is around 15 to 17%, and that can only happen in Europe around 2035. So this would be the original enthusiasm and the optimistic forecasts have been pushed a bit back or later in the future. Definitely, there will be a larger penetration with e-mobility, but it will vary regionally, and it will very much depend on the success of transformation of general mobility in each individual region. So I personally do not anticipate any major big bang in this respect. On the other hand, if I should anticipate a certain tipping point that would eventually lead to the exponential adoption of the technology, it would be determined by 4 or 5 elementary factors. The first one is technology itself and the capacity of the technology to process the necessary data, then having the relevant infrastructure, transport infrastructure. Secondly, we should not forget about the customer, the client. So the early adopters will appear among the very specific groups, among people who are very open to new technologies. We can see examples already today. We have seen certain examples of autonomous transport, even in cargo. The timing will also play. Time, safety will be important, and also the automatic feature system that will be able to help the autonomous cars. Then, of course, you need to have the testing road segments available and other testing facilities. Then you need to take into consideration also the administrative and permit procedures. And last but not least, economic aspects will play an important role. Vehicles that are not autonomous will definitely be far, far cheaper than the newly appearing autonomous vehicles. And of course, the clients will want to see what is the added value compared to the conventional vehicles. In the later levels of deployment of autonomous transport, we will probably see first implementation and practical implementation in cargo and in industrial areas and in fleet, vehicle fleets. So it will be more an investment decision. it is very hard to foresee what will follow. We still need to bear in mind in geographical terms that it will still be extremely important that the vehicles can be taken over by a human if needed. However, the development is progressing fast. So we do see this trend. The tipping point, which I mentioned, is coming near. But for the time being, scaling is difficult. And it will require many changes, particularly in the rural areas where it could help, but the situation there will be very different. It would perhaps require even a dedicated discussion. You can have a look at the website of the Union on the program for rural development. The situation in the Czech Republic is even more complicated, particularly in view of what you mentioned, the large number of small municipalities. Then we also have the difficult system of tax allocation, the division of powers and competencies. So the topic is extremely wide. I've already mentioned the topic of cybersecurity, which I would also like to comment. It applies not only to vehicles, automobile industry, but smart mobility and infrastructure in general, where you talked about smart mobility, or in the past the S-mobility meant rather shared mobility, and today it's more smart mobility. Sharing remains a sub-segment of the topic.
Cybersecurity for many people is not a topic sufficiently understood, and we underestimate it. But I went through what has happened recently, and there are many, many examples of activated emergency sirens that led to, for example, panic of inhabitants and citizens of Dallas, or theft of data, of patients' data in Singapore, or actually breakdown of the whole smart city network in Atlanta, and similar incidents related to traffic management system in LA, or an example that happened in New Delhi. Instead of the names of stations, there was suddenly a pornographic clip. So there are many, many cases like that. And here in the Czech Republic, we need to make sure that we need to learn a lesson in order to have efficient regulation, solid legal framework, in order to be able to identify these trends. We need to know what are the good standards, how to select and purchase systems. And Mr. Kolovratník has already said we need to cooperate well. And it will require capacity building, and also we need to be aware of all the risk categories and all smart services, not only transport, but also water and healthcare. The level of risk is different. Of course, it's different in large cities and smaller towns. So a whole range of open issues, interesting issues from the point of view of the technological development and also of the mindset. Thank you very much. What you have mentioned actually would deserve to have a conference each. And what we heard about the cybersecurity, there are so many risks that we can't imagine what can happen if. However, in a simplified way, from a lay viewpoint and with a certain naivety, we could say it's similar to COVID. My children, they've said, you know, it is a huge risk, but it has always been here. The risks were here, and it's about whether we realize it or not. And it's good to realize risks related to autonomous vehicles, because there will be more risks than we can even imagine, because the hackers will come up with risks and vulnerabilities faster than we. And what could happen is actually much worse than what we have ever experienced. So thank you very much, Mr. Vojnar. We will hopefully get back to autonomous mobility. But I'll go back to what we heard from Mr. Starchevsky. He talked about bicycle transport in cities and towns. And there are several items. It's first the climate change. I deal with European strategies a lot, and the European objectives by 2050 in this area are not getting any weaker, even after Corona crisis. There has been an agreement made at the level of prime ministers that the goal 2030 would be 55% of reduction of greenhouse emissions compared to the previous levels. And that should lead to innovations, to a major change. And when we hear about it and read about it in the newspapers, it might sound like it's crazy. We can't do it. But when you read the strategy and explanation why and justification why, these disruptive innovations are possible, they are happening, and the change by 2030 is possible from the technology point of view. It's quite obvious even today, but then there might be one single thing. We will achieve these goals, but then there will be a blackout. What will happen in a city with a smart transport if there is a blackout? We are more and more dependent on digital infrastructure, on fast or broadband internet. We are also more dependent on power, on electricity. And it could break down at a single moment. And we might say, no, it will not happen. We have backup systems. But look at COVID. You know, who expected it? You know, a bat or a research institute in China, and what are the consequences? How would you imagine smart mobility if there is a blackout? Or can we expect? Well, with COVID, we learn how to work from home. And to a certain extent, we could get rid of cars in cities, as we will not commute to work. When COVID came, we, those who live further away from the airport, it was wonderful because, the motorways were empty. Everybody was sitting at home, but they needed the broadband internet. Well, from the point of energy or power, there has been development, and I would mention smart grids. And if I was to say what is going on, it's the decentralization of sources. So even in the city, there shouldn't be a single source, but multiple sources. Also, from the point of view of types of fuels, I saw in Berlin that their backup center is based on carbon. It's part of the design of the whole system, and if the power industry is also decentralized, the smart grids are able to disconnect or to limit non-priority users and actually direct electricity to transport, schools, or other critical infrastructure. And it's the question of the design. And the same applies to smart mobility. It requires smart mobility hubs. That's what also the railway administration offers. Germany is a role model for us, and we see it also at the level of railway station. So in Berlin, they created a pilot project showing how such a smart railway should look like, including smart cars. And it becomes the smart mobility hub and resolves the last mile and improves the quality of public transport. Because without such hubs, people would rather use cars than public transport. So it's difficult to answer the question, but I think that the answer regarding resilience is in decentralization. I often talked about it to my students when I talked about traffic management. If you have the central management and the headquarters are out, then if it's decentralized, the system is able to work. And this is the principle that should be applied to smart systems, so that if there is a blackout or any other disturbance, the element get disconnected and still work. Perhaps not in the optimum way, but still work. People who deal with space industry, they know what I'm talking about. The basic function in case of emergency situations still remain, despite it's not optimum, and the spaceship is able to get where it needs to get. It's the graceful degradation of the system. This is the concept. The system needs to be resilient and be able to reconfigure and respond to any issues that will definitely happen. I will briefly comment on that. I did not expect that we will also talk about the new block in the nuclear power station. I am a big advocate of those stable sources and nuclear sources. You see what is happening in Europe sometimes. It's good, but renewable sources, wind energy, etc., etc. But I will tell you, I visited both the nuclear power plants that we have in the Czech Republic, and they are a stable source of energy. And I'm really angry at politicians that we lost a year with an irrational debate about geopolitical stability. If we have stable, strong sources for the industry, it gives the answer to our solutions that we discussed. Before I came here, I saw on TV pictures from Atlanta, and there was no petrol in petrol stations, and screenshots that were shown on TV was that people were actually fighting with each other, and there was a warning, you should not take fuel into plastic bags. It's dangerous. So just imagine, and it was an outage for a single day. So just imagine what would happen if we had a longer-term blackout. As for risks are concerned, yes, I agree. Smart grids, decentralization, that will happen in combination with robust central sources. But what I really liked, and I will definitely be happy to advertise it, Tesla vehicles, for the end users, they offer a comprehensive system. They offer you a solar panel and the wall-mounted charging system for the battery. So the combination, perhaps, of these three approaches could answer the question about security. Yes, thank you. One more thing is whether the way we live, or we will live after COVID. Perhaps it will allow us to reduce the number of cars and vehicles in the cities. What we heard from Mr. Starchevsky, that the bicycle mobility or other ways of mobilities are important. We have a question. Yes, I can see it. Bicycle, scooters, electric skateboards, all these sort of means of micromobility, could it contribute to really reducing the number of vehicles in towns and cities, or would it or could it cause a more individualized nature of transport, and that's why a low level of dependence on certain types of or means of transport? Yes, definitely yes. Perhaps I have a question for Mr. Starchevsky. What is your experience in Poland? Where in the Czech Republic some things are changing with those who really use cars. In Prague, I'm really sorry for the bicycle users because they have very narrow paths. Well, he will definitely respond, but briefly I will say I'm an optimist because the industry and the private sector is the initiator and the government is only catching up. Well, Uber, for 2 years, we've been discussing whether we should have the analog license-based service or digital. And nowadays, not only in Prague, but also in Pardubice and smaller towns, there are scooters available. And again, legislation is lagging behind. Cities say it's wonderful service, it's cheap, it's efficient, but we do not have a legal framework for cases where people actually make mess in the towns. But I believe we will manage. So there are initiators, then the governments are lagging behind, but we are doing it. It's doing well. Polish experience now, please.
Neslyšíme. Asi, jestli má pan kolega vypnutý.
Perhaps your microphone is off. We can't hear you for the moment.
So, in my opinion, all our debate about autonomous vehicles or electric scooters is the big question: what is smart right now? And is smart something that has a lot of technology, and is it smart if it has an application on your smartphone, or in my opinion, smart is everything that can decrease urban greenhouse gas emissions, and and that's why I'm not sure if electrical scooters are good in that, and also the electrical cars and so on. They are important. They can be an addition for the transport. They can be an addition for the system, but the thing that we have to do is to decrease production, decrease emissions, decrease the number of cars in our cities, and allow people and redesign cities to make them more safe for pedestrians, for bikes, and make them better for our health, for the air in the city, and for the climate. So that's smart in my opinion, and we also have a big discussion about electrical scooters, and we have the struggle between people who use them and pedestrians, and we've been also working on legislation about that.
Rozumíme vám, ano.
Yeah, in Polish, same, but it's still new. It's still a new experience, and it's also such a case that cities are more advanced in that, and I see we also have the mass, and for instance, city of Kraków or Gdańsk are making special spots that you could use it and leave the scooter, that it is not making a mess. But it's also but still when we have a blackout, as you said, if we could if it would happen, we have to focus. We have to think about analog transportation. That's why bikes are great, because you don't care if there's going to be a lockout, if there's a super system that can allow the electricity to work. So that's why we need vehicles. We need transportation that use less energy, less power. That's why you could be prepared for a blackout and use and focus the energy for bigger needs. We need energy for our homes, for heat sometimes, or other things. So the transportation, it's such a sector that you could save the energy if you focus on trains, if you focus on public transportation, if you focus on bikes. So I would think this way.
Děkuji pěkně. My máme...
Thank you. We have one question from the website that also concerns autonomous mobility. The question is whether there will ever be a fully autonomous mobility. Now, I actually think that Mr. Vojnar already answered the question. No one really knows what is going to happen in 20 years, even if you are a real expert. But perhaps I would turn the question a bit around. In 10 or 20 years, what type of vehicles or cars do you think, Mr. Vojnar, will prevail? On the one hand, we hear e-mobility will be growing, but at the same time we hear no, hydrogen is the great opportunity. So what will be the key opportunity? Obviously, there will be major changes unless the climatic changes are dropped in Europe. Probably they will not. Then we will have to change. And what is the probability of the change in a foreseeable time? So I would like to know, if I buy a second car, what driving engine should it have? My Octavia has mechanical gear. I insisted on having it, otherwise I would have an automatic one. And it's so smart that I'm lagging behind. The car has many elements already towards autonomous mobility. So in the 10 or 20 years horizon, will there be combustion engines or other types of engines? What do you think? If we look at the entire history of cars, you will see coexistence of various types of engines. In the past, it would be petrol engines, diesel engines. So the history is open to various types of systems. The National Action Plan of Clean Mobility is based on the principle of coexistence. So the policy does not impose on the industry which of these technology should be preferred at what time, and it is right. On the other hand, you have the real-time world, which needs to address the challenges of climatic changes. And also there are the decisions on the limits under the Green Deal. And there isn't much, it isn't likely that they would be reversed. And that they will apply not only to the automobile industry, but also to other segments. This means agriculture, industry, manufacture, steel industry, all kinds of sectors that are even more investment demanding. So this is not only a matter of the initial decision. E-mobility has been on an exponential growth at the moment, much higher than for the hydrogen technologies. However, this does not mean that there is no future for hydrogen technologies, but with respect to the costs and the cost efficiency and economy of the technologies, it may take some time. Hydrogen today is also generated from fossil fuels, and only some 4% are generated from clean resources. So it will be a matter of costs, of approach and willingness of the customers to pay for the technology. And I think it will be, again, the implementation will be gradual. So first, probably it will be implemented in trucks, cargo trucks and buses. And I see this happening over no sooner than a decade. We see improvement in storage cells, battery storage cells today, which helps to develop e-mobility at the moment. And I'm sure there will be new generations of the technology coming. The current system will probably, the wet electrolyte will be replaced one day in the future by dry electrolyte, which again will contribute to more massive spread and dissemination of the storage cells and of the infrastructure necessary for e-mobility. With the development, the technology will find their place in time. They will be implemented and adopted in different segments, and this has always been the case, and I think this is going to happen in the future too. Perhaps one more comment on the blackout question. Economists say that the whole history of GDP growth in national economies has always closely correlated to the growth in energy consumption. However, today, some studies, such as by McKinsey, some studies indicate that we will reach a plateau situation, meaning that GDP will not be necessarily linked to further growth in energy consumption, which basically confirms what Mr. Svitek mentioned, that the relating technologies will also find their place. There will be more opportunities for circular economy. So we see that if there are, for example, also reasonable regulatory conditions applied, that would also help spread the technologies in homes. Only thus will be able to meet the Paris climate criteria. So the discussion could be very, very extensive. Thank you.
I would like to comment on that on behalf of railway transport. Public sector is a sector where Europe plays an important role. There is an agreement that until 2025, there will be ETCS management system. It's the European Traffic Control System. And at railways, the autonomous traffic is much easier. It's just common sense. You know, there are no other participants of the transport. You have tracks that is secured, perhaps behind a fence, and the only potential collision is two of such means of transport. But then you can have sensors and the control system on the engine actually checking the location. We have GSM-R, GSM for railway, dedicated communication between these vehicles and the dispatch. And that will be an obligation starting from 2025. I'm not quite sure what is the definition of level 4, level 5. There will be a driver, but it will be a control role. And it's a small step to full automation. And the last sentence, metro, it's a standard operation. There are autonomous lines, and even Prague is expecting to have a line without drivers. Yes, again, it seems to me, and Mr. Vojna has said it, that step by step, the new solutions that are brought by the private sector, the development could be actually faster than what we envisage today. And I liked about our parliament. Oh, thank you. Thank you for that. No, it was a surprise for me, a positive surprise, and I know that there is a European directive. But one thing that we discussed 3 years ago or so at the university in Ústí nad Labem, drones were used to monitor electric networks. And that was the news. Yes, it's wonderful that drones can be used instead of helicopters. but there is missing legislation. And then in the comments or the consultation process, there was, we need a piece of legislation and we have it. And that's wonderful. And I know that there are certain issues, but the fact that we have legislation related to drones, it seems that drones is a nice toy and it will not be used, but, we see there are opportunities, and it relates to the question I can see from the audience, whether the smart mobility will be sustainable, whether it will contribute to better quality of our environment. And we, had this idea that the GP would prescribe a drug and the drone will deliver it to a small village to an elderly lady. Is it totally unrealistic, or would you say, as you are also active in the US at the university, there are solutions like that use drones, and they are able to transport smaller items, and it could also contribute to urban mobility? Yes, there is quite a few examples from city logistics, and I know that Elon Musk paid a lot of money for a patent. And, there is a small train that delivers the goods, and then drones are used. I think that this is quite often used in the US. In Europe, drones are also used, and when I look at it, I say it will not be a single technology that would prevail, hydrogen or e-vehicles. It will always be a combination or a mix of it. E-vehicles are great because they have no nanoparticles and there is no pollution. But on the other hand, they can travel only on a limited distance. But in Germany, if you look at hydrogen cars, they are much more suitable for longer distance routes. So I think that it will always be a mix of all the options. And the smart feature should be how we will set this mix and how we will respond to the needs for mobility. We need to understand why people travel, and we should then offer them a service that actually matches their needs. And if the public transport service is able to do that, then people would take it as the mobility service and they will not use vehicles, and there will be a reduced number of vehicles. But the idea that we will replace all the vehicles by e-vehicles, it's not realistic. It will require a new organization of the transport, all the hubs, etc. Yes, we do not have much time left, so I will have one question for all of you. We started this panel discussion by a presentation what intelligent urban mobility is. We talked about autonomous mobility, about drones, about bicycles, about railways, and they will be soon autonomous. So we have various elements, and we need to create a system. So the question would be, how can you imagine smart mobility not for the 21st century, because we have already progressed in this century, but let's say mobility, or how will we exist well with good transport accessibility, let's say in 10, 20 years, what the situation is going to look like based on your experience and knowledge? I think that transport reflects the way we live. It reflects urbanism, and best transport is no transport at all. So if we need mobility services, it should be offered to those people who really need it. Václav Havel said that technologies are neutral, but you need to build a system, and that's the beauty of smart technologies and systems, that they cannot be purchased. They need to be built and developed, and you can't do a leap change. You need to do it step by step. You need to understand the system. You have to be able to design it. And that's why the digital twins are the basis, and you need to test it and then only transfer it to the real world and implement it and do it step by step in a systemic way. This is the right direction. It's not the objective or goal, because we do not know what the technologies are going to look like in 20 years. We didn't know that even 10 years ago. But we need to use the current possibilities in order to improve the quality of life and in order to live better in cities, because more and more people live in urban areas, and there will be greater requirements for mobility and for the quality of the environment. And the technologies can help us, but they cannot do it on their own. I'm not sure whether the question is accurate. You know, in 10 or 20 years, you know, it will be totally different in 10 and in 20 years. Well, let's talk about the perspective between 10 to 20 years. I think that scooters, those small smart devices that I can see with a mobile phone, I can, you know, get them live and then leave them when I do not leave them when I do not need them. Then, of course, railway transport and battery transport and hydrogen transport, combination mix of that. I also believe that in case of small vehicles such as Citigo, partially electric vehicles, and a big question mark is for longer distances. Perhaps whether we will have dedicated lines for, let's say, autonomous trucks. Why not? Mr. Starchevsky, could I ask the same question to you?
Microphone.
Microphone, please.
I'm an architect from my education, and I don't have I don't have the power to provide any future. But I think we should focus on those inventions, those ideas that already work and that could be that were designed in the 20s or even 19th century, which I mean, of course, trains, buses, and bikes. But of course, we need to improve them. We need to develop them with 21st century technology, for sure. But I think the goal is not to think about the product that could be sold and that could give the GDP or economical growth or etc. But I think we should focus on those solutions that could provide massive impact. I mean, we should talk about not about an autonomous or electrical expensive Tesla car, which is of course good for some people, but a few people. But we should focus on those ideas that could be used by massive citizens, because we should talk about a bike that could be affordable. We should talk about train system that should be and what to do to be affordable. That has to be affordable, and we should talk about what to do to allow maximum people, maximum citizens into the system and make them travel safe and in an ecological way, and that's the goal. That's the thing we should think about. Wideness and massiveness of transportation, not about luxury, not about the product side of it, and of course the state and the municipalities and the cities' role is to support those ideas, support people, and provide them the best infrastructure for bikes, for public transportation, that it's possible. And I'm really happy that we talk about it, and I'm really happy that this discussion happens in the United States and Europe and Czech Republic and in Poland and elsewhere, because that's the global aim to make transport, public transport great again. And that's and the discussion, it's the way, the tool to make more and more people conscious about this need, and then I hope it will provide it will give the political change as well. In this everywhere basically. So thank you for being here and to talk with you.
Děkuji mnohokrát, pane Vojnare, při vaší celoživotní automobilovém průmyslu. Tak jak byste viděl v tu budoucnost za 10 až 20 let, jak říkal pan Kolovratník?
Já nevím, jestli mám lepší křišťálovou kouli než kolegové, asi nejspíš ne, ale většinou se říká, že přeceňujeme to, co se stane jen příští 2-3 let a úplně podceňujeme vývoj, který nastane v těch dlouhodobějších horizontech. Takže ta situace se může opakovat a já jsem si taky nedokázal dřív, v roce 2008, když jsem byl konfrontován s prvním iPhonem, představit, co dnes vlastně budeme pomocí těchto zařízení vlastně schopni dělat. A to samé se týká smart urban mobility, která podle mého názoru bude charakterizována asi tím, že bude daleko víc schopná využívat data a bude postavená na daleko větší konektivitě, daleko víc na internetu věcí, ale která zároveň přinese to, co chceme, aby naše města, naše místa, kde žijeme, udělala víc lepších žití, aby systémy byly víc efektivnější, aby byly víc udržitelnější. To je asi ten hlavní cíl. Já jsem to názoru, že celá ta oblast té městské mobility a tam opravdu celou řadu výzev, ale které mohou být svým způsobem i šancemi. Ty výzvy, ty dnešní problémy, to je především taková ta disparita mezi tou úrovní těch různých servisních, řekněme, služeb a na straně druhé poptávky. Víme, že prostě pracujeme s píky, s vrcholy a tak dále. A celé to plánování vlastně kapacit fyzické infrastruktury je velice obtížné z tohoto pohledu a dřív se to dělalo prostě tak, že se vždycky kapacita budovala a ta fyzická a ta těžká dopravní se doháněla vlastně ta potřeba, ale my potřebujeme možná víc takových těch holistických, těch chytrých řešení, abychom zvyšovali efektivnost toho celého systému. Co bez sporu, podle mého názoru, bude velmi silnou změnou, bude vlastně struktura té chytré mobility. protože dojde daleko k lepšímu propojení těch různých vrstev. Asi pan profesor Svítek ví taky velmi dobře, o čem mluvím, protože ta jedna vrstva je ta fyzická infrastruktura, ale máme každopádně takovou tu operační technologii, která nám umožňuje generovat taková ta surová data přes komunikační technologii a informační technologii a tam dojde k tomu průlomu, že vlastně občané, a nejen občané, ale i vláda, průmysl budou z toho moci profitovat, že se budou moci generovat nové servisní služby, že transportní společnosti budou moci zvažovat lépe, jak scalovat různé služby, diferencovat je podle toho, kde co je opravdu zapotřebí, líp řídit infrastrukturu, architekturu vlastně všech systémů. No a co potřebujeme od politiku, je, aby tady byla prostě velká potřeba a ochota se angažovat v té debatě ohledně dat, ohledně toho, jak vlastně pracovat, zajistit implikace nových ekosystémů, aby fungovaly spolu navzájem velmi správně. Pokud to se nám podaří, a to se netýká pouze mobility, opět podtrhuju, ale vůbec třeba těch městských energetických systémů, vody, veřejných služeb, budov a tak dále, tak budeme mít systém, který bude charakterizován tím, že bude v určité míry i autonomní, že se bude líp organizovat a že bude víc hlavně odpovídat tomu, jak se bude měnit i ten lidský přístup, jako ten behaviorální systém, se kterým možná dnes pracujeme ještě velmi málo, na který zapomínáme, ale který je extrémně důležitý. A poslední věta, poslední poznámka, hovoříme často o smart cities, zapomínáme na to téma smart villages. My víme, že vlastně chytrá města nemůžou být nic bez dobře fungujícího venkova, takže v tomto směru je to velmi důležité, aby se, řekněme, celý ten region, celá ta lokace, celá ta země dokázala rozvíjet nějakým rozumným organickým systémem. Takže možná jsem byl příliš široký, každopádně za mě děkuji za pozvání a za možnost vystoupit zde.
No, mnohokrát děkuji i za ta všem samozřejmě diskuse.
Thank you, Mr. Vojnar, for the contribution. This has been a great topic, and I probably will recommend this as a separate autonomous topic for the whole next conference. We have been trying to promote this topic, and we want to explain to the municipalities, not that we are bringing them toys, but that we are bringing change in a mindset. So this might be a topic for the next year. Thank you, everyone. Thank you very much. This was the final panel of our conference. I appreciate that you address this highly complex topic of urban mobility, and thank you very much for your contributions. It is extremely difficult to summarize the whole conference in a couple of words. Let me start with yesterday. Yesterday, we sort of laid the basis or fundaments to what we really need. We need to grasp the talent that we have in the Czech Republic. We need to make a show on the global stage, and we need to transform our skills into better conditions for living in the country. Today, we have been perhaps more specific. We talked about eHealth, about digitization in education, and we ended up with mobility. And we talked about how not only the cities, but the entire society will work in the future. The humankind is entering a new era of cloud and cloud communities, and we need to adapt to that sociologically, economically, technically. I am originally an archaeologist by profession. So that's why we have in the graphics the stone. This also represents why we do things as we do them. It's not the pleasure of holding a conference. We want to show the strength of technologies, and we want to show that what a stone meant for our ancestors, digital technologies mean for us today. So we should not be afraid. We should grasp technologies. We should be trained and educated. Technologies are omnipresent, and they are available for all kinds of areas. So let us take the opportunity and use it for the better future. My name is Sarah Pollock. Thank you once again for your participation. I thank the Institute for Politics and Society and the European Liberal Forum, and let us move forward to the future together. Thank you.